Scrutiny panel. Thank you very much for everybody attending. As usual, what I will do is I'll just go around the room, ask everyone to introduce themselves. I think most people who are here, who are regular attendees, have a name badge, and I guess if others are going to come so much more regularly, we might need to invest in more. So without further ado, if I go around the room. So my name's Dina Romero. I am a councillor for South Down in Bath, and I chair this panel. Liz.
Good morning, I'm Liz Hardman. I'm a councillor for Poulton, and I'm the vice chair of this panel.
Leslie.
Morning, my name's Leslie Mansell. I'm councillor for Radstock.
David.
Good morning, David Harding, councillor for Chew Valley Ward.
Chris. Oh, and Chris, could you say whether you vote or you don't vote?
Christopher Batten, representing National Education Union, non-voting member.
Thank you, Chris. Joanna.
Councillor Joanna Wright, representing Lambridge Ward.
Ruth.
Hello, I'm Ruth Malloy. I'm one of the Western councillors and recently rejoined this panel. And I'm a voting member.
Thank you very much, Ruth. Alex.
Hello, I'm Alex Beaumont, councillor Keynsham North.
I'm Toby Simon, councillor for Bathwick, substitute member today.
Kevin.
Good morning, I'm Kevin Burnett, National Association of Head Teachers Professional Association rep and a non-voting member.
Thank you. And I will start with Suzanne.
Suzanne Westhead, Director of Adult Social Care.
Anne, sorry.
Anne Smith, Assistant Director of Adult Social Care.
Alison.
Alison Bourne, I'm the lead member for Adult Services and Public Health.
Thank you. Laura?
Good morning everyone, Laura Ambler, Director of Place for Bath and North East Somerset for the Bain, Swindon and Wiltshire Integrated Care Board.
Thank you. And Becky?
Good morning everyone, I'm Becky Brooks, I'm the Director at Bath and North East Somerset Third Sector Group, otherwise known as 3SG.
Thank you. Kate?
Good morning, Kate Morton. I'm the Chief Executive of Bath Mind. We're a local mental health charity and third sector provider. I'm also the Chair of Bain's 3SG.
Thank you. Are you planning on making statements?
No, Dean, not today. We haven't issued statements Thursday.
Thank you. Becky?
Morning, Becky Reynolds, Director of Public Health and Prevention.
Paul? I meant you.
Good morning, Martin Pellow, Head of Leisure and Physical Activity within Public Health.
And absolutely not called Paul.
Chris Chatton, I'm Project Manager in Public Health, Leisure and Physical Activity.
Thank you very much. And can I ask everybody to use their microphones when speaking, not least because it will be on the webcast, and also for anybody who uses the hearing loop. Thank you. Oh, I'm sorry, Mark, I completely forgot about you and Kerry.
Morning, everyone. Mark Downford, Democratic Services Officer.
And finally, Kerry.
Morning, I'm Kerry Williamson. I provide the Scrutiny Officer support to the panel. Thank you.
Thank you very much. I'm going to turn back to Mark to tell us what to do if there's an emergency.
Yeah, great. Thank you, Chair. So, if the continuous alarm does sound, you must evacuate the building and proceed to the assembly point. From this room, we follow the green running person signs to the exit, using either the marble staircase or the main staircase. Please do not use the lifts. The assembly point for this building is the Orange Grove grassed area just outside Brown's Restaurant. And there's an evacuation chair for use by disabled people who so wish in the corridor outside the Council Chamber Public Gallery. Alternatively, the area at the top of the marble staircase has been designated as safe refuge where persons needing assistance should assemble. Thank you, Chair.
Thank you very much. Okay, so item 3, apologies for absence and substitutions.
Just two I'm aware of, so apologies received from Councillor Crossley and Councillor O'Doherty.
And we have Toby.
Toby is here as a substitute for one of them.
You can choose, Toby. Thank you very much. Right, declarations of interest. Are there any declarations that haven't previously been made? Okay, lovely. Urgent business, I have no urgent business. We have no statements, I believe, that are going to be made. So we will now move on to item 7, which is the minutes of the 15th of January. So, any comments on the accuracy of these minutes? Liz?
Thank you, Chair. Firstly, under the Cabinet Members' report from Paul May, there was a reference to consultants being used, and I think in looking at the fact that cuts are being made to various budgets concerned with adult social care and children's social care as well, I think it needs to be there that the Council is considering using consultants to improve what they're doing. So I don't know if Mark wants me to read out the statement or to hand it to him afterwards. Okay. And there's a second reference I'd like to make to the minutes, if that's okay, Chair. At the end of the last meeting, we, as a panel, we voted unanimously a resolution asking for the delivery of the cuts to be delayed until the consequences of these cuts were further known and investigated.
Thank you, Liz. And I know that point was conveyed to the resources panel, and perhaps we ought to ask for the feedback from that panel.
Thanks, Chair. Yep, the corporate panel met on the 23rd of January and considered the draft budget proposals, and the findings from that meeting are in the report going to Cabinet on Thursday under matters arising from scrutiny, and within that there's a request to Cabinet to fully examine the potential downstream effects in response to its third sector budget proposals. So that point has been captured and fed back to Cabinet when they consider the budget on Thursday, draft budget, sorry.
Okay, thank you. Do we want to add that in some way, a link to that then in our minutes? Thank you. Okay. And Kevin?
Yes, please, just to note, if we can, for the minutes, that I'm still awaiting further clarification around the safeguarding process from Chris Wolford, which I understand may come up at the next meeting, but just to keep tabs of it, please.
Okay, again, can we note that and that request and make sure Chris Wolford is aware so that that report does include that? Okay, thank you. Any other comments on the minutes? Toby?
Thank you. I was just going to record that in terms of the accuracy of the minutes, on page 16 it does record the conclusion that you resolved at your last meeting. But obviously the follow-up information is useful.
Thank you, and I think it was just important to make sure that it was kind of sort of underlined, as it were. So thank you, Toby. Any more comments on the accuracy of the minutes? Okay, so with the various notes that have been added, are we happy to pass those minutes? Yes? Okay, thank you, everybody. Right, next item is the Cabinet Member update. So over to you, Alison. So obviously we have received your update, so if this is any additional information or anything you want to draw our attention to. Thank you.
Yeah, okay, I won't go through it in detail then because you have had time to read it. But just to say, it covers the current performance. We've got getting on for 2,000 people receiving adult social care services. That number fluctuates a bit, and it went down slightly in this most recent report, and that was due to there being more people on interim funding. But the people on interim funding generally feed into being on long-term funding, so it's a very sort of dynamic picture. Carers, we're doing some more work on data cleansing of our carers' figures because there may be some double counting in there, so we're looking into that. Our reviews have improved slightly, but there is still further to go, and the same with occupational therapy assessments. The waiting list for that has gone down. You may remember we flagged it up as a particular issue at the last when it has improved. But there's a way to go, and the only way that's really going to improve is if we get more occupational therapists working for us, because that is the biggest problem. Mental health teams continue to be under pressure. in the finance section, we're showing that we are projecting a overspend at year end of about 1.4 million. And the main reason for that, there are a number of reasons, and we have been under increasing pressure this year in terms of demand, and also, as you all know, inflation is a major issue and costs have gone up. So it is a challenging position. But also within the savings target we had for last year, a significant amount of that was savings on the learning disability pool. And we haven't realised all of those because the process for achieving that is going through an individual assessment process, and obviously that is taking time. So we've only made partial savings on that. Just picking up on the point that you made, Liz, about the third sector, we have identified additional short-term funding to enable us to do a full review of the commissioned services in the third sector prior to making any decisions about reductions in funding. So that is a commitment in the budget. And then within workforce, we're at the moment holding vacancies in the CLCs because of the potential changes. So we'll hold those until we make the decision on Thursday, and we know what the future of the homes is going to be, and obviously we're discussing that in more detail. And just in relation to the provider services, we talked before about United Care Baines, which was set up as a pilot project to try to increase capacity in the home care market, because we were having terrible problems getting sufficient home care capacity. It's been very successful in that we now have no difficulties at all getting home care capacity. So we're probably going to not continue the pilot once it gets to the end, and that's a joint pilot with the RUH, and it will be a joint decision about what we do. And I think that's it. We're discussing community services transformation in more detail later.
Thank you, Alison. I will now turn to the panel for any questions. Liz.
Alison, it is really good news. There's going to be a review of the services that we commission from groups within the 3SG. And I'd like to just ask a little bit more detail as to what you're going to do. Bearing in mind the information we're getting from 3SG is that they are delivering some of our statutory services. So we really need to look very carefully as to what they're delivering and how we are going to be dealing with them in the future. And I just wondered about timing. When we're looking at the community hub and the Wellbeing hub part of it, and the triage sector, it's going to last, the budget is there until March 2025. Now, are we looking at 3SG? Are we looking at continuing with their services for another year, as we as a panel have asked that we delay the cuts until we see the consequences of them and explore them fully? So who is going to be involved with this review? Are we going to involve 3SG, who are obviously the people who are delivering it, and obviously don't want to see a blanket cut of 10% right across every group? And what is the timing involved? And I would just say it's really good that we're having a review rather than start to implement cuts.
Our intention was to have a review, and even prior to the budget, we have made a decision that we were going to be reviewing all the third sector services in the next financial year with a view to recommissioning them in 2025. Then, obviously, you're all aware of how tight the budget settlement has been, and we were asked to do something sooner, and now we're in a position where we are going to do the review before any decisions are made. I'm going to hand over to Suzanne to say a little bit more about the detail of the process, but the intention is to do it with the third sector, not to the third sector.
So I just want to take your point, Vice Chair, around how we're going to manage this, the time frame. Right now, we haven't started any of the work with the third sector, and we will have to begin that, because for us it's about what's Care Act compliant. That's what we need to make sure is, and very important in that is prevention. So integration is also important, carers. So what we're trying to do is align our spend to the third sector to our statutory responsibilities. Because you are right, many of the third sector here would say, well, we're doing a lot of statutory work as well. So we need to work with people and say across the Care Act, where we're going to go with this and how we're going to deliver it. But we don't have the same amount of money that we had, in previous years. And the other thing is, it's a direct award at the moment. The ICB leads on the direct award, and the third sector finances will be in that contract for this year. But after 25, then we're in a different position. So we do the work now for next year. There is still, and it does say it in the Cabinet papers, there is still savings up against the third sector, and what we're trying to do is to lessen that as much as we can and find a way forward, so we've got time, as Councillor Bowen says, to be able to implement a joint strategic approach around this.
I can ask supplementary. So are you saying that what is happening at the moment will stay in place for another year, and within this year you are going to be looking at discussions with the third sector as to ways forward?
Yeah, the year of 24, if you like, we're going to be working through with this, and we haven't started that process yet with the third sector about what are our priorities, what do they think are the priorities, and where's the money going, where we're going to put our money up against over the next year. What I am saying is there still is a saving in our savings at the moment. It's not anything like we had before. We had 800k up against it. It's reduced, but if you look in the Cabinet papers, there still is a saving, and we're trying to find a way that we can bring, we can ease it in, or we can find a way to manage this in a better way. And that's what we're looking at the moment, because I've got to write to the ICB and tell them what's in the envelope of the direct award. And we haven't worked through that yet. We haven't set on that figure yet, but I still have a 400k saving in my budget, which says, talks about community services support. So that is still there, and Alison and I are trying to find a way forward so we can ease that in, as she said.
Sorry to hold it. So 402,000 is going to come out of the budget for this coming year, is that correct?
That will be our intention. That's our intention, to talk to let the ICB know that. But we've got to find a way through, because this money has come down nationally, and we're trying to see if we can use that to support it. But of course, as Alison said at the very start, we have an overspend. We're going in an overspend already. So we're not in a place where we can afford to deliver. We've got £1 million, we've got 1.3 savings to do this year as well, on top of that, 400. So it's not straightforward. So I'm not being, I know I'm not being clear, but that's because we haven't worked through how we can manage this 400 pressure.
Okay, and before I bring Alison in, I just want to, some clarification. So there's the 800,000 saving has now been reduced to 400,000 that's going to be somehow found this year. But is there still this sense that is going to be a kind of like cliff edge of saving, or is that going to be sort of somehow? I appreciate that you've not worked through it yet, but obviously it's clearly not fair for the third sector to have to try and find this saving in the next couple of weeks.
Yeah, and we're not. Apologies, I didn't put my mic back on. So I've got a 400 saving up against this still. We're trying to find an easier way so it's not a cliff edge. So that's where we are. But we need to work with the third sector before we can do that.
I'm sorry, I'm doing a Liz now. I'm hogging the floor. So just to be absolutely certain then, so that 400,000 saving before, or as part of your work with the third sector, you will also be considering how those savings would impact on our statutory services as well.
Yeah.
Okay, thank you. Alison, I know you wanted to speak.
I was just going to mention the additional money that's short-term funding that's been announced by the government, but Suzanne mentioned it. We don't have any detail on it, so we don't know how much we're getting. We don't know whether there will be particular conditions attached to it, but that could be a resource that we could use, but we don't know yet. But we have also found some other funding internally to help within the budget to help with this. So either way, we will be able to manage these savings in a sensible way over a longer period of time than we thought a few weeks ago.
Well, that feels a little bit more reassuring. I do appreciate that it's not an easy place you're in. Kevin and then Ruth.
Thank you, Chair. A couple of questions, please. One around the occupational health assessments and whether they were having an impact on any discharge from hospitals, and whether you felt there was anything that could be done in a short-term targeted way, either through health support or something else, to try and get those assessments.
I think two very good questions. First of all, our no right to reside, which is called those people that are delayed in hospital, terrible term, is really good in Baines. So we would be the best in BSW because our numbers are so low. So I don't think the occupational therapies assessments aren't affecting that. Where it really affects, I believe, is people in the community who are waiting for different pieces of equipment, and often very small bits of equipment, but would make an absolute difference to their lives. But occupational therapists, the numbers are low, first of all, in the system. So when you've got a vacancy, and they're hard to fill then as well. So that's the issue that we have. You asked me about the plan we have in place. You can see the numbers already coming down, and the work we're doing with HCRG in particular at the moment, and Anne might want to comment on this, is that we are bringing the numbers down, we are triaging, we are actively looking at those waiting lists and prioritising those most in need. And you can see the numbers coming down already since the last time we were here. Anne, do you want to add anything?
I'll just add in terms of the occupational therapy apprenticeship programme, although it's not a quick win, it does give more capacity within the teams. So where we've got vacancies in the teams at the moment, we are using some short-term agency occupational therapists to plug those vacancies. We also, our apprenticeship programme is not just for adult social care, so we are working with our children's colleagues around children's OT and our DFG colleagues. So all of us will be advertising for occupational therapy assistants, and all of us will be contributing to a bespoke training person across the 3 areas of the council. But we continue to review the waiting list and direct people or provide people with those small items of equipment very quickly.
Great. Can I please, thank you. I should have said right at the very beginning, I'm very bad at this, so I do apologise, but well done for getting those numbers in all those sections, because they're people, not just numbers, and we do appreciate that. My last question was really around the Baines Care, the UCB element that you're doing, and the question was, why do you think the market's changed as it has, that you'll have bounty in this area? Yeah. And would it be premature in any way to end the pilot, or would it have any costs that you're having to redo again if the market went back again? Yeah,
I suppose firstly I would say that the commissioning has changed. So just during COVID we had quite a low demand, and then as we came out of COVID, the demand went up and up. And we lost a number of providers as well, domiciliary care providers. We've done a lot of work with providers, and we've got new providers into the market as well. And that happened over just under 2 years ago. And that has made the difference, having a range of big and small providers. Because that's one of the things about Bath and North East Somerset is the variety of the providers is really important. We just don't have one large provider that we're dependent on. We have a range of big and small providers, and some of them, when I've been out to see them, you can see how well improved their services have been. They're much more personal centred. Also, they're using IT much more now. Not instead of people, but actually the way if you walk into somebody's home and you're a carer, you've got a phone, you're straight away you're connected to the main office. Once you scan the barcode of your phone and all the activity that goes on. So they have used technology a lot more, but we have more providers in, so we've got more more ability to buy in the market now than we ever had before. So I did think about this in relation, and we probably want to talk about this in relation to UCB. Whether this is a pilot. We've had it for nearly 2 years now, and actually at the very start it was going well. It was going well, but we were putting everybody through that at the time. Everyone coming out of hospital was going through UCB. Now, because we've got so much in the market, there's no need to put it through UCB, and therefore their numbers are very low, and they have been for quite a long time. And their unit costs are higher than what we would buy in the market as well.
Okay, Ruth.
Yeah, thank you. I just have a couple more questions about the apprentices, the occupational therapist, which I think is great that you're going to be taking on apprentices. So I just wanted to ask, how many have you got actually at the moment, and how long does the course take, or how long will it take for them to be fully qualified? Is this one in with UE, is it? Where are they? I was just wondering. And is it post A level? So how are you reaching out to find new apprentices, and how many have you got? Thank you.
So in total, we're going to be just about to go out to advert for 3. It is run in partnership with the university. We are offering that opportunity in the first instance to our existing staff who work as occupational therapy assistants as a career development, and then we will be going out to anybody within our area who wants to apply. It is a 3-year course, and it's a mix of, so the people will be with our teams learning on site, and then they will have university days as well.
Okay, any more questions, comments? Joanna.
Hi, thank you. It's really useful to hear that the scrutiny panel that we held on the 15th has clearly been a check and balance in the local democracy system, because I don't think unless we had had that meeting on the 15th, whether there would have been the concern risen by the cabinet member of the amount of change that is about to take place to the third sector. I'm aware from speaking to people in the third sector that they were very abruptly told about the cuts that were going to happen. And from the conversation that you are now giving to us, it sounds like you're now working with them and you're working through this. But what happened to them was essentially they were told very quickly that there was going to be this major change, and that they had to find, I think, a quote that it needs to happen. I hear a cabinet member who isn't in this room was said to them. So I'm alarmed by this process, because clearly we've now found out there's a whole load of statutory duties in place that we as a council have to deliver. We know that other councils, I've heard that Devon, realised that they were up against significant cuts that have to happen, and nobody's doubting that. But they went instantly to the third sector and ensured that there was a discussion months and months before, so that this absolute fear did not fall onto local people's heads. So, I mean, it's really good to hear that this scrutiny panel has been effective, and the statements made by the third sector have been successful and have been heard. But we are still facing cuts, and it is still not clear how you're going to take this forward and who is going to be supported. And why wasn't there a better mechanism in place months before? That is essentially my question.
I don't know who wants to take that, Suzanne.
I was just going to take that, and I think we already said it. Our plan was always to have a strategic approach in 24-25. That was always the plan, and we were very upfront about that. Because we got such a bad settlement in December, we found ourselves in a much different position. So we had to look across the adult social care, the budget that I hold, as well as the third sector budget, which I also hold. So it's important to understand that we didn't want to be in this position. Our plan was we had a full year to work with the third sector to work through what the approach would be for 25-26. But we were pushed into a position much more than we wanted to be, because we already had agreed a figure of 1.3 million for adult social care. That was what we were going to do. That's what has gone into the papers for council on the 20th. We then had to go back again and look across the council. There was still a gap, so that was that's why it was done so late. And I think we've explained that quite a few times. And we didn't want to be in that position. None of us wanted to actually do this, but we had to be open and honest as well with the third sector and say, this is one of our proposals. This is what we're planning on doing. Do you want to add?
Alison, perhaps you'd like to comment on government.
Well, where do I start? What I was going to say is just building on what Suzanne said. You know, this had been planned, it had been discussed with the third sector, but it was going to be done in a different way. And we were then presented with a savings target, which the minute we heard it, we had major concerns about. So we weren't just saying, oh yes, we'll do that. We were saying, you know, this is potentially problematic. We are very worried about it. Are there any other ways? Are there ways that we could be bringing more income into the council? You know, are there alternatives? So I think, you know, you were pushing. This panel was pushing on an open door when it expressed its concerns, because we shared them.
Chair,
share them.
As we have members from the 3SG community,
I'm going to bring them in, Joanna. Thank you, and it is unusual. I wouldn't normally bring in members of the public, but I know this is obviously especially relevant for your sector. So I don't know who wants to speak first, Becky or Kate?
Thank you, Chair. Just to come back on that, we didn't have any knowledge or detail of the savings required. We knew about it on the 15th of December, and we were given that consultation month. So this isn't something that was known to us at all. Very difficult time, obviously, of year, and that's why we've been doing the work that we've been doing. So no, it wasn't known. We've been making quite clear for a very long time that because we've had either zero or below inflation uplifts in our contracts, that our savings have actually, in real terms, been hit quite hard for us. So this was a kind of double blow. So I just wanted to come back that actually we haven't had any consultation, any working with the council on these savings. We've urged in our statements, in our questions, in our conversations we've had with members to come to us. We know it's a challenging time. We want to work with you, but we know our services best, and we were planning on doing that this year. So that's why it feels like we're a little bit on the back foot at the moment.
Thank you, Kate. Becky?
Just on timings as well, I'd really urge the council to, we keep saying we've got a year, but actually to get those contracts in place, we're probably looking at September, so we do really need to get on with things very quickly, and we do need to be around that table. I think there's an opportunity here for us to be creative and bold and brave about the way in which services are delivered in the future, and we cannot do that unless we are around the table, and organisations feel it's difficult enough. There was an article in The Guardian over the weekend about cuts across the country. We know councils have to make really difficult decisions, but if the third sector is always the first to get cuts, we're helping to deliver those statutory services. One day local authorities will be looking to the sector, and it won't exist anymore. It won't exist in the way that it used to, and it won't be there to help anymore. So we really urge the council to start looking differently at the way in which services are run. Just bring us in.
Thank you. I'm seeing the nods from directors and from the cabinet members. So I think your message has been heard, and obviously it will be well recorded from this meeting too. So thank you. Jo.
Can I ask a question about, there's been an assurance that no individual currently in the system will be forced to be moved from their bespoke support in terms of commissioned beds, and I just wonder what the position is on that.
I don't know what the question is, Councillor. Can you just give me a bit of clarity so I can answer it?
It's to do with commissioned services of beds, of individually commissioned beds.
Yeah, so I think you're thinking about the two new commissioning units that are due early this year, one in March and one in May, and that is Higgy and Sulis. They're new. We're really excited about them. An opportunity for young people in particular who are in transition to be able to use those services, as well as people out of area, bringing those back. So no, we're not talking about moving people out, we're talking about moving people in.
But often people who are already out find those that are their homes, and you're now moving them away from their home, and although you're saying it's their new home, this is because they're our BAMEs, actually you're taking them away from their home, and I'm concerned about that language.
Anne's going to come in now, but actually that's all about their Care Act assessment. You can't just move people because you feel like, I've got this new project here locally, but actually you'll be thinking about their connections to local services and what's right for them, and that's what the social worker, their assessment and review will look at. But Anne wanted to come in, Anne.
Yeah, I think you've mainly answered the point, Suzanne, but just to clarify, so if someone is an existing home bespoke service, whether that be a residential or a supported living service, obviously if that service no longer exists or is available, some services have a age limit on those or are coming to an end, such as residential colleges. If services are no longer able to continue, then obviously we would need to look to move people. But we cannot purely look to move someone from their home based purely on cost. So this does represent a really excellent opportunity for those young people who are moving on or who are at home, who maybe need to have that next step. If the person's outcomes aren't being met in their existing setting, then we will have a conversation. But as Susan says, we have to be compliant with our legal duties in order to move anybody.
You're giving us an assurance that no individual will be currently in the system will be forced to move from their bespoke support system?
We cannot force anybody to move.
Okay, all right, thank you. And I have one more question. So I met with officers last week about temporary accommodation, and I've heard that in terms of the budget, Councillor Bourne, that in approximately 2020 we were spending £150,000 on temporary accommodation, and now it's nearly £1 million, and that there seems to be a big issue around this. So how are we dealing with this, and what work is being done to ensure that we aren't essentially spending it on travel lodge, which seems to be a factor?
That's actually housing, it's not my area, but I know that we are building and opening and acquiring more temporary accommodation so that we are able to accommodate people in our own temporary accommodation rather than having to buy hotel rooms, etc. But I think you need to speak to Matt McCabe to get the full answer on that.
But the impact on public health is significant, and the impact on 3SG is significant, so it does affect this committee.
I'm not denying that, and at the last meeting I think we did have a paper on homelessness where this was discussed, but what I'm saying is that I'm not responsible for, and I don't have the detail on the additional accommodation that we are developing, but I know that we have increased the amount of temporary accommodation we have, and it's an ongoing piece of work because there are increasing numbers of people requiring temporary accommodation because more and more people are becoming homeless because of the housing situation in this country.
Perhaps we should have an update on homelessness and health at a future meeting, so we'll make sure it's on our work plan. Right. Any other questions for the Cabinet member at this moment? Okay, well, thank you very much, Alison, for your report and for the officers as well for everything they're doing within that as well. Okay, so my next item is an update from Laura on the paper that has been circulated. So.
Thank you, Chair. Given that the paper's been circulated, perhaps if I just draw out a handful of points. So the first one around the prescribing ordering direct service. The panel will recall that we have updated you a number of times that was currently under review. That review has now concluded with significant engagement, particularly through January with local health and care providers, including colleagues in primary care and care homes. And we are now set to discontinue that service in its current form later this year. Instead, practices in care homes that use the system will offer that service instead. Now, there is a transition period, so this is not going to happen overnight. We're anticipating 30th of June 2024. So over the coming weeks, we'll be looking to make sure that we set out what that smooth transition will be. And obviously our priority at the moment is offering support to those 85 colleagues that will be affected by that closure within the ICB. So there's an FAQ, frequently asked question, which is available on our website. And of course, I can come back to the panel in due course when we know more information on that. The other thing I just wanted to pull out was around improving cancer diagnosis and survival in BSW. As you would imagine, given that it's one of the national ambitions to treat people earlier, we know that then treatment is less complex. We know that it's more successful, and we know that with fewer long-term effects. We are focusing on a number of projects, and we've listed those for you in the report. So I just wanted to pull out a couple. So in particular, we have got some roadshows that are happening. We are focusing very much on screening for that early diagnosis, very much on making sure that we provide information, so whether that's language specific for certain groups of our communities, or indeed easy read information that explains the benefits of cancer screening for those with learning disabilities and autism. We are focusing on that. We've also got additional cervical screening sessions outside of normal hours and pop-up sessions. And we're specifically looking at awareness around targeted lung health checks. So this is across parts of Bath, Swindon, Salisbury and shortly Trowbridge to be rolled out. They're being offered to current and ex-smokers aged between 55 and 74. And the aim is to identify and treat people with lung cancer even where there are no obvious symptoms. So they were just a few areas that we wanted to highlight that BSW are working with our partners on. And then finally, Chair, I just want to draw your attention to a written answer that we've provided in relation to the question on the hospital improvement programme. I think we just wanted to know clarity from this panel on where we were at with that. The RUH benefited from health infrastructure HIP2 funding in 21-22, as we know, and that's what enabled them to develop their future estate needs work and develop a system of care that we know at the moment called Shaping a Healthier Future, and that informs our care model. As part of the new hospitals programme, we then know that it subsequently benefited from the 40 million towards the Dyson Cancer Centre, which I updated the panel on last time. So as it stands at the moment, there is no new funding from the new hospitals programme. All of that funding is fully subscribed. So as we know, the BSW integrated care system now oversees capital investment priorities. So as I said, Chair, we will keep you updated as and when any of those new priorities arrive. But I just thought it would be helpful to provide that written answer because I know it's been requested. So I hope that clarification helps. Happy to take any questions on any of that. Thank you, Chair.
Thank you very much, Laura. Toby.
Thank you. I welcome the proposal for primary care cancer project. I note that there's going to be a special programme for the Ashkenazi Jewish community, BRCA diagnosis, BRCA2, and having had a diagnosis and passed it on to my cousins, I think it's really important that we pick that up and disseminate it around Jewish people in the area.
Thank you. Yeah, and I think that's what we're looking at now. The key thing I wanted to focus was targeted, using population health management data and making sure that we then are exploring all of those avenues for communication and directly targeting those communities as well. So thank you very much. Thank you.
Thank you. David and then Kevin.
Thank you for your paper. Obviously, this will bring a few more people into the system earlier. But we know nationally that in England that meeting the cancer targets, we haven't really met them since 2015. So I wondered about your capacity going forward, and if at a future meeting you could update us on some of the standards that are being achieved in the ICB and the IUH.
Thank you. Yeah, I'd really welcome that actually, and subject to your agreement, Chair, and the panel, if we bring back a fuller update, I think that would be really helpful. It's quite complex in terms of some of those targets that we are and are not meeting, and as you say, some of that is not unique to BSW, it's nationally. But I would very much welcome to bring back a full update. Thank you.
If I may supplement. I mean, I do know, and as I'm sure you know, that they have managed to keep 3 targets going forward. Whereas before I think we had 9 or something for different diagnoses, etc. Will the ICB just be reporting those 3 new targets, or will you keep some of the data points to allow you to compare going backwards, even though they're not nationally mandated to collect?
Yeah, that's a really good question. So just to clarify, this is nationally we're no longer required to report on the 9 metrics that we were originally, including the 2-week wait. Now there are 3 metrics that we're specifically required to report on and measured against. From BSW perspective, you're right. I think we would prefer to have a look at what's the appropriate information for us to be able to monitor and evaluate the true picture moving forward. So as part of that update that we bring back, we do have a performance dashboard. It goes to our integrated care board, and we report it there. We can set that out, and then you can see the sorts of things that we'll be reporting on and the underlying information.
That's great. Thank you.
Thank you.
Thank you. Kevin and then Ruth.
Thank you. Thank you, Laura, as always, picking up all the detailed bits, but thank you for the answer as well on the HIP programme. Two points, really. One is around the HIP answer that you were very kindly able to get out. And that is sort of you mentioned about the future estate needs and the shaping the healthier future and the system model of care that was being developed. Which parts of that has the ICB adopted, and how does that fit in with where you currently are? And the second point was really probably references a paper that's coming a bit later on in the meeting around the social care transformation programme, and it mentioned in there about the community hub, and I know that you sing its praises very highly, and that it seems to be a key part of anything that the ICB is doing. And so I was just concerned to read in that paper about the funding, that there didn't seem to be any secure funding after March 25, which seemed a bit alarming considering, as I say, the crucial role that it seems to play in the jigsaw that you're mapping out for us.
Thank you for both those questions. If I take them in turn, so the first one around the care model. As the panel may recall, the care model, the Healthier Futures, developed into the ICB care model, which focuses on personalised care, so person-centric care, and we talk about that awful phrase, left shift into the community. So really the focus being on how do we get that seamless, joined-up pathways of care, focusing on the individual and providing as much as possible within their community. Clearly, as you look at that then, how you utilise estates and how you plan for delivering care could look quite different as we move into the future. So that's the bit that we're looking at and that we're working through. So some of that does mean that we need some of those specialist centres. So the Dyson is a fantastic example of that, the cancer centre. And some of it will mean that we need to look at how we're utilising our primary care, our community hospitals, etc., as we have been doing on a number of other initiatives. We're working directly with primary care at the moment with something called an ADEPT tool, a planning tool, to understand what those future requirements will be as well. So it's not just with our acutes, it's across the whole system to understand how we make sure that we are able to treat and care for people in the right place at the right time. So that's how we're using that informed position, and obviously then that informs our strategies moving forward around capital and estates. If I come on to then the Community Wellbeing Hub, and you're right, I do sing its praises at each panel, and you're right, and we do see it as a significant plank of our provision, and partly of the success that Suzanne has referred earlier in things like non-criteria to reside. I think the key thing that the ICB want to stress is that we need to have a sustainable model going forward. So we're supporting the Council and working with third sector partners on what a sustainable business case will look like for that community wellbeing hub, and indeed for our third sector. I think the points made by our third sector colleagues are really, really clear and articulately made. This is about having a sustainable third sector as we move forward. We'll come on to it a little bit later, but an example of what our roles might be as organisations, the ICB are very clear when we look to community commissioning in future. There's an expectation on that integrated care-based programme that we want our providers to work in collaboration, and there's an expectation set out in these commissioning arrangements that includes working with the third sector. So we very much recognise the role that the third sector can provide. We very much welcome it, and we very much welcome, as I think Kate was saying, that often they may have the solutions. You know, being at that interface, being there, delivering on the ground, often they may be able to give us information about how we can do things in a different way, and that's what we mean by that left shift of funding. Okay.
Thank you, Laura. Ruth.
Thank you. I was very interested to read your report and looking at the carrying on about improving cancer early diagnosis and survival. I was be very interested to know how things are progressing within the new Dyson Cancer Centre. I know it hasn't opened officially yet, but the Macmillan, within that, the Macmillan Cancer Care Centre, and how that's all going to fit in, because they obviously they do a lot of good work in providing information and support for cancer patients, so survival. So is that something, Chair, that we could perhaps request for another time to have some more information about that, because I think they do a great. I have to declare an interest. I used to be a volunteer there, but this was pre-pandemic, and I know it's gone from strength to strength. But I would like to know more about that. Thank you.
I'm happy to bring back a further update. I think, as I said last time, Macmillan are actually going to be based within the cancer centre itself, and that is a huge part of the offer there, because obviously it's the whole holistic offer that we've got there. So very happy to bring back what that looks like. And as you may also recall, we were looking very much at the therapeutic services on offer and how they were designing the centre in and of itself, which again is another avenue that you might want me just to explore with you.
Chair, may I just come back? And I was just thinking about working with others, as you were saying, in partnership, how they, so also some information perhaps about how they work with others, for example, the Penny Bronze Centre and the Marie Curie, but particularly because they offer many alternative and supplementary approaches, don't they, treatments. Thanks.
Thank you, Ruth, and thank you, Laura, for agreeing to add to your workload. Liz.
Laura, I want to dig a little bit more deeply into your involvement in 3SG and in the hub, which is situated in Peasdown. You're saying that you're going to do things differently, but you're still going to put money into supporting the 3SG and many of the organisations that will be delivering some health facilities for people. So you're still going to be involved, but you're saying you're going to be involved in a different way. And does it mean you will be part of the review that's taking place looking at commissioning services within 3SG?
So I think when I say we're looking to do things in a different way, I suppose build on the foundations of the good work that's happened. So when I say a different way, looking at a more sustainable funding landscape moving forward, because I think we've had recognition that quite often some of those funding arrangements by their nature might be short-term. That doesn't help our third sector partners in particular. They need certainty and they need clarity. I think also recognition, as we've heard today, they absolutely deliver some of our statutory services, not just the non-statutory services. And actually even some of those non-statutory wraparound services are the prevention and avoidance mechanisms that stop things then having to tip into statutory services. So what I'm supporting is that we are very much hoping that the ICB will continue to be a partner in that, working with the Council and the third sector themselves to look at what a sustainable model looks like moving forward. At the moment, the funding is through something called a Better Care Fund, which is a joint funding arrangement, and that's something that the ICB would continue to support if we can look at the appropriate business model that we want to be funding. Does that help a bit?
It's good to hear you're still going to be involved, obviously, and in putting money and supporting many of the organisations within the 3SG. As you say, they deliver statutory services for us. You keep mentioning sustainable. I'm really sorry to drill down even further. What do you mean by sustainable? Do you mean, I mean, to me it means, well, cutting back, and doing only what's absolutely necessary.
To me, I think it means that certainty and that clarity and confidence in the funding coming forward. When we say sustainable, quite often we might be reliant on non-recurrent funding sources. And so I think we just need to agree amongst ourselves what's the best business model for delivering our commissioned services. So that's what I mean by sustainable, a sustainable funding solution, so that we have a sustainable third sector. Speaking to the points that Becky raised earlier, if we don't, then obviously we can't get complacent, can we? We're very fortunate for the third sector that we have here in Baines, and we need to do our best to promote and support it.
Thank you. Any other questions from the panel? In that case, then I've got a couple of questions myself. They are sort of on matters that we have spoken about before, but for example, pharmacy closures. I note that there are more and more pharmacies that are shutting. Particularly, I noted this for my own ward in Southdown. And then what will be the impact on all those services that are expected to be delivered by pharmacists that have been taken from GPs to try and alleviate the pressures on GPs? And then sort of related to that, I think we've heard quite a lot about, what are they called? They're called assistants of some sort, and I have forgotten what they're actually called, who are to be stationed within GPs. I mean, is that becoming a live issue for us in Baines? And then dentistry. I'm aware that there is a college that is in place in Bristol, and I really wanted to be sure that we would, in Bath North East Somerset, be getting additional dentists. And if not, ought we be looking at growing our own within this region too? And then my last question is around child mortality, which I heard a very worrying news item this morning, and it'd be interesting to have your comments on that. I suspect that might well be a future agenda item.
Chair, may I follow up your question? I think you might mean physician assistants.
I do mean physician assistants, absolutely.
Yeah, and your comments just made me think of something. I gather that the GP funding settlement for next year is only going to be 1.9%. And I gather also that pharmacists, for instance, get more for a blood pressure check than a GP does. And I just wondered if this imbalance in funding arrangement is threatening our GPs here in Baines.
Thank you. So just a few light questions to end on.
Just a few light questions there indeed, Chair. They're quite big topic areas, so if I give a headline and then I think what we need to do is come back. And you'll recall we had a presentation recently from Victoria around pharmacy, and in particular picking up that closure point and the impact on services. So very much, as you would expect, we are working directly with our pharmacists. We are working with our primary care colleagues, particularly on those settlements, as you say, and trying to work out activity and trying to work out how we do that together and think about the services that we are delivering. And there is incredible pressure on our GPs and on our pharmacists at the moment. We do know that. We often talk about our acutes and thinking about what level of pressure they're under. We have something called an OPAL system that tells us, is it 4, 3, 2 or 1 for our acutes. We actually now have the same for our primary care. And we actually ask all of our primary care colleagues to fill that in so that we can get a temperature check across the system. And what we're seeing from that is that we know increased pressure. So that is very real, and we will work with them on their funding settlements. I'll need to come back on the programme about physician assistants. Sorry, I don't have an answer for that one today. Excuse me. Dentistry. Again, when Victoria came and spoke to us about dentistry in a previous presentation, it's acknowledged that there is a new college in Bristol. That's now open and operational. We need to work closely with our partners, not least BNSSG as well, and we will be looking at what we can do to make sure that we benefit across that intra-system-wise, if you like. So we can bring an update both on dentistry and pharmacy. They'll be worked through the usual agenda planning process, I suggest, Chair, if that's okay with you. And then child mortality. Was that the news item around the under fives and the concern about under fives? And it's very distressing, isn't it? And actually some of it is around dentistry, and as we know, an increase in children being admitted to acute hospitals to have tooth extraction, an increase in obesity, etc. So all very worrying statistics and all very worrying directions of travel. We do have a strong children and young persons programme board in the ICB, and we are looking at both their physical and their mental and emotional well-being with a very targeted focus on early years. So that is absolutely a priority of the ICB and also our Integrated Care Alliance. So again, very happy, Chair, if it would be helpful to bring back some of the initiatives that we're doing around children and young people.
Thank you, Laura. Becky.
Thank you. Just an offer as to whether it might be helpful to do that jointly, because public health and prevention is also very heavily involved in children and young people's health. So in terms of under fives, that might be a joint thing if that's helpful to the panel.
That would be very helpful. Thank you very much, Becky. And you mentioned an acronym that may not be familiar to those on this panel, the BNSSG.
Apologies, Chair. Thank you for picking me up on an acronym use. That's our neighbouring Integrated Care Board. So Bristol, South Gloucestershire and North Somerset. Sorry for using the acronym. Thank you, Chair.
I think it's Bristol, North Somerset and South Glos, but anyway. Okay, let me just check if there's anybody else from the panel, Eleanor, and then I'll allow you to ask a question. Eleanor.
Well, Chair, I welcome this review of child mortality. It's been a concern of mine since 2007 about the abnormally high number of child cancer deaths in the spectrum between Peasdown and Midsummer Norton, but particularly in Radstock. If we could look at cancer deaths too.
Thank you. I would assume that would have been picked up, but thank you for highlighting it. Okay, well, thank you very much, Laura, as ever, for your full and candid answers to our questions. And we look forward to seeing you at our next meeting. So I'm now going to move on to item 10, which is the Community Resource Centres and the outcomes of the consultation. Alison, would you like to introduce this item?
Yes, thank you, Chair. This paper summarises the responses to the Community Resource Centre consultation that was undertaken between the 9th of November and the 18th of December last year.
Carry on, Alison. Don't worry about these three.
And it makes recommendations that will be taken to Cabinet for approval later this week. The consultation which came to this panel in December covered the 3 care homes that were taken back under council control in October 2020. And those
Alison, could you just speak up just a tiny bit?
Yeah, okay, I'll try and get a bit closer to the microphone. It's not very comfortable here. And those are Charlton House, Cleve Court and Coombe. It's worth saying that Bath and North East Somerset benefits from a buoyant care home market with a good choice of provision for most needs. The areas that are less well provided are for specialist dementia care and services for younger people with physical dependencies. And this has become more of an issue recently following the closure of a local Leonard Cheshire home, which specialised in this particular area. We also send a lot of people of all ages who have the most complex needs out of area because we don't have enough specialist education or care services, and that's a long-term issue. One of the advantages of running our own services is that it gives us the opportunity to use our in-house facilities to fill gaps in the local market. And the decision to consult on potential changes to the use of the 3 care homes was because we recognised we were not doing that. We were struggling to recruit, especially to nursing posts, which had led to quality issues. And we were not delivering best value on the services provided because they are operated from relatively small units that do not have the economies of scale of larger facilities. It would be possible to charge more for placements in our in-house services and deliver better value if they were to provide more specialist care. So that was what we were looking at. So we undertook a review of the 3 services, and following that review, we consulted on a number of proposals. And they were, firstly, to develop Cleeve Court Residential Home into a centre of excellence for dementia care, including nursing care. The second proposal is that we enhance our offer at Coombe Lee Residential Home to enable younger people with more complex needs to remain closer to home, so that we would be providing places for older people and younger people with appropriate needs in that home. The next proposal was that we closed and deregistered the remaining 10 places at Charlton House Nursing Home, and then developed the site to provide alternative care provision and/or housing options that would meet the needs of the local community now and into the future. And then the last proposal was to offer community groups and charitable organisations use of the day centre spaces at the community resource centres at a reduced rental rate. And that was dependent on the organisations offering services that were accessible to the care home residents and the community. So the care home residents would directly benefit from those services as well as people who lived locally in the community. So we consulted on those proposals. The consultation was open to the general public and included meetings with staff, residents of the 3 homes, and also with the relatives and friends of residents. The Council received a total of 45 responses to the consultation. Over half, that was 53% of responses, were positive towards the overall proposals for the community resource centres. Nearly a third, that was 31%, disagreed, and 16% were unsure. Within that, some recommendations received more support than others, and there's a full report on the outcomes of the consultation attached to the report in Appendix 1. Okay, so having looked at all the responses to the consultation, we are now making the 4 recommendations that will go to Cabinet later this week. The first recommendation is that we develop Cleeve Court Residential Home into a centre of excellence for dementia without nursing. So that is a change from what was proposed. We were proposing to have some of the beds as nursing beds. And there are a number of reasons for that change, the original proposal, which is set out in the report. The second recommendation is that there is no change, and that is to enhance our offer at Coombe Lee to enable younger people with more complex needs to remain closer to home. And that was supported by more than 50% of respondents. And there's evidence that intergenerational mixing can work well for both age groups. The third recommendation is to go ahead with the deregistration of the remaining 10 places at use in Charlton House Nursing Home, and then to develop the site to provide a residential school for young people with complex needs. If this recommendation is supported, the needs of the current residents at Charlton House will be assessed individually and will work closely with residents and their families or their representatives to determine suitable alternative placements and to ensure a smooth and safe transition. There's no change to the fourth recommendation, which was to offer community groups or charitable organisations use of the day centre spaces at a reduced rate. This proposal is well supported, and it will help to reinstate the original purpose of the community resource centres, which was very much them being a resource for the community. And that stopped with COVID because the day centres closed at that point. And then the fifth recommendation relates to recommendation 3, and that is that if Charlton House is to close, then we commence a full feasibility study in relation to the change of use for Charlton House to a residential school. And it's important to note that the development of this school will enable us to meet the needs of vulnerable young people within their local area, which we are not able to do currently. So it will support close family ties and support access to the local community, local friendships, and going forward, employment and training. We believe that these changes will enable us to optimise the use of the 3 council-owned buildings that are of high quality and are purpose-built. The proposed changes will allow us to target use of the facilities on areas of greatest need and will deliver the much-needed efficiencies and quality improvements in both adults and children's services. And I'm going to see if Suzanne wants to take any more, or if we're just open to questions.
Yeah, I'm happy if Suzanne wants to add anything, or Anne.
I was only going to add 2 things, and then Anne may want to come in. First of all, just thank you to everybody who's been involved in this, because this has been a complex consultation, and wanting to make sure that both staff and residents and the general public were engaged in the consultation. I also want to just say as well I know each one of the panel members received a letter around staff engagement and consultation. We do not go into consultation until the decision is made. We have to await a decision made by Cabinet before we can actually go into consultation with staff. It's only then have we got a decision when we go into formal consultation with staff. So I just wanted to let you know that's the process. Anne, do you want to add anything?
Anne is declining that offer.
Yes, declining the offer.
Okay, right, okay, so over to the panel. I'll start with Alex.
Well, thank you very much. As you know, as the local council, this has been something which I've been trying to kind of engage with as much as possible. I've got 2 points really. I think one, I'm concerned about, obviously we'll be awaiting for a feasibility study to see if it can go forward into another use, and obviously if that feasibility study comes back that it's not suitable or something, then that could mean that quite a good resource for the council could then be left empty or something. So do we have any idea on what we would do to kind of make sure it's not wasted? And the other point I had, which is probably more for children's services, if we're going to, if it becomes there's a special residential school, what would that kind of mean? Because I know in Keynsham we're not really aware yet on what is kind of the options. So I don't know whether we could get a kind of update on that. Thank you.
Thank you so much for those questions. We've got the Director of Education here with us over in the corner there. I would say about the feasibility study, they have been around, they have looked at the building, and it is a beautiful building, and it is set up in a way that each room has their own ensuite. It's probably quite clinical at the moment, and for older people, and of course it is, and for it to be a school it looks something different. At the moment we don't see a big problem with being able to re-provide the use of that building for children, for education. But I'm going to ask Chris, because he's been quite connected into this.
And before you speak, Chris or Rosemary, perhaps you'd like to also introduce yourselves as well.
Chris Wilford, Director of Education and Safeguarding for Baines, and apologies for the noise sneaking in at the back.
Hi, I'm Rosemary Collard. I'm the Head of Education Inclusion in Baines, and I have responsibility for increasing the sufficiency of places for children with SEN, which is why this is sort of under me and my project.
I'm Paul Mayer. I'm a Cabinet Member for Children and Young People, and I'm here today to support this proposal, Chair.
Thank you.
So I'm going to answer, yes, the question. So, I'd just like to reiterate what Susanna said. Yes, we absolutely have been round to have a look at it with our property services people, and had a good look at the building on the floors that were not occupied, obviously. And it is absolutely ideal. The adaptations would be fairly minimal. There's 2 floors, I think, with bedrooms on, and we probably as a school would only want 1, and we would want more classrooms, but the base of it with the kitchen and the communal areas would stay. So it's just going to be very minimal adaptations that will be needed to the building, obviously, to make it suitable for a residential school. Possibly more work on the outside areas to make them secure and good for the children. And then you asked about the type of children that would be in the school. Was that the question?
I think what would end up being there, like what is a residential special school kind of thing?
Okay, so a residential school is there's basically a school with a children's home attached is how it works. And what we would hope to have was more day placements than we would residential, but we would offer a mixture of both, because obviously if you're bringing children back or not sending them out of county, the hope would be that they could attend the school and still be at home, but there will be some that obviously can't, so that will give them the offer of the residential element. It's the data that I looked at for the highest costing placements and the highest complex needs children that we are placing currently out of authority, the needs around autism and obviously behaviour issues. So it's not streetwise children, it's children who've got high severe autism who are struggling to survive at home and be supported at home that would tend to be. I don't know if that answers your question as to what a residential school is.
Yeah, I think it does. Just obviously, if I could just do a quick supplementary kind of thing, it'd be good to know what kind of timeline we've got for this, like from where it closes to this and then reopens. Obviously, is it going to be a large gap, or will it be as minimal as possible?
It would be as minimal as possible. We're very, very keen to get the school open as soon as possible. We have the money already allocated to do the works and to get the school open, but there will be a delay because we have to do the adaptations, we have to get the feasibility, and we have to get planning, all of which can happen. We also, as a local authority, cannot open a school, so there would be a tender process to the Multi-Academy Trust and the independent sector, so who would run this. But I can do that at the same time as the other work is being done. It would run concurrently. It wouldn't add to the time. But yes, with planning, although we have done a pre-planning, and it does look as if it's going to be quite minimal, the planning application, but we don't know for sure yet. We reckon that we could probably, hopefully, get the school open within about 18 months. Is that okay?
Thank you. And I know, Anne, you wanted to come in.
Thank you, Chair. I just wanted to add some clarity around timescales for you. And just some clarity around, I'm conscious that, subject to a decision being made, obviously we have a notice period that we would need to give to our residents and to our relatives, and we also have a consultation time period with our staff that we need to comply with. So should Cabinet take a decision on the 8th, we would not be in a position, following those timescales, to release that building up until probably the middle of March, if not, and we're looking at the end of March, ideally. I also wanted to clarify as well, given obviously what Rosemary just said about feasibility studies and they've seen the building and pre-planning application, we have explored, and we did explore a number of options around the building to inform the consultation. So I just wanted to clarify that this wasn't something that was agreed and approved pre a Cabinet decision. Obviously the feasibility study is part of the Cabinet decision, so we had looked at a number of potential options. And lastly, I just wanted to say in terms of supporting this work, obviously, is that when young people over the age of 18 are placed many miles away from us, talking to them and their families about that transition into adult social care services is very difficult. Having our young people locally, particularly those young complex individuals who we can start introducing to some of our other service offers, we can start working with them, we can start in-reaching, is a much better offer for those young people than trying to travel hundreds of miles to get to know them. We are also proposing, should Cabinet approve our recommendations, to keep the kitchen open as an adult social care resource. in Charlton House, we provide many meals to the residents of Hawthorne Court and the surrounding sheltered bungalows, and we would like to offer that with our employment service as an opportunity for those young people to learn skills and to develop.
Thank you, Anne, and thank you, Rosemary. Okay, I'm trying to think who was next on my list. Is it Liz?
I think it might be.
It's Liz.
I'm going to challenge this a little bit because I'm not really sure why Charlton House is being closed. Because at one stage it was a magnificent building, the staff were very proud to work there and very involved, and then suddenly it's gone downhill, we're told, and it's now just got 10 beds and which are going to close. And an awful lot of council money has gone into keeping Charlton House open, because when we had the report that it was inadequate and then it became requiring improvement, a lot of time, effort was put in keeping it open, and then suddenly I do think we have a fait accompli, and I think the decision was already taken. Excuse me if I am making comments like this, but I'm jumping to conclusions, and my conclusion is the decision to close Charlton House was already made. And I just wonder, the reasons given was that lack of staff, etc. Also, there's sufficient capacity in residential and nursing homes in the market, and that's going to be coupled with commissioning plans for further nursing care that we're going to put in place. So, it looks like to me that we're going to pay higher costs down the road. We're saving £300,000, and I just wonder, is this a paper exercise? So that would be my first question, and I would like to ask Rosemary a question in a moment, if that's okay, Chair. Okay, thank you.
I think it's taken us a long time to get to this position. When we took Charlton and Cleve and Coombe back over 2 years ago now, we were reviewing the care homes and the needs of the care home, and we had one, which was nursing care, and that was Charlton. At the time, I think it's fair to say that we really did need, during the pandemic, we really did need Charlton Nursing Home at that stage. But because the commission market has changed, and its offer of you've seen the list of beds that are available at any one time, we have to go with the demand of the people, if you like. And the demand right now for us is our young people, is those young people with special needs. And for us, that's our biggest pressure and biggest quality of service. So if you think about young people transitioning from children to adults, they get a different experience. If we can keep them local and they can go to college locally and they can be connected with their communities, then in the long run it makes, I'm going to say that word, sustainable budget for us, because it means we've got a quality service and we're actually paying less for it and better outcomes. So that's how we got to this. It took us a long time, I have to say, with the consultation and the feedback. I don't believe the decision was made beforehand. I was away at the time, I have to say, but when I came back, it felt like we had a consultation, we got the feedback, and then we've moved forward with this recommendation now to Cabinet for Thursday. So I hope that answers your question, but we have deliberated a lot about it, and what I most worry about is the fact there's 10 people in there at the moment who, when you go into Charlton House, these are very older people. I mean, they're over 80s, over 90s, many of them bed-bound. So we've got to think about what's right for them. I'm always very supportive of children, but my priority is keeping those people safe. And if the decision is taken on Thursday, my big priority will be about moving them and supporting their families in a safe way. So that worries me more than anything else right now. I know that children's services are clear that the need is greater, and it certainly is. We see it every day, and the impact it has on our services long term as well. So it feels like it was the right decision, but it took us some time to come to it.
Thank you for your explanation. I might not totally agree with it, but thank you for that. Rosemary, if I could ask you about the balance here we're hearing, is that the balance is that we need to look after our young people, that we're not providing them with enough services, especially children who are autistic. And I guess two questions, if I may, Chair. One is, how far are we down this road in converting Charlton House or thinking about a feasibility study to acquire Charlton House for young people? So how far are we down the road? Because it looks like maybe the decision was made quite some time ago about funding and having in place a place for children with complex needs. But I'm slightly disappointed in the sense that I thought it would be more of a residential home, because our figures show that we're sending 204 children out of county with very complex needs costing £0.75 million. And I just assumed that if we are going to go ahead and build, have a school for young people with complex needs, mainly autism, that it would be residential rather than just a school. So are we missing an opportunity here of not providing more residential places and saving us far more money in the long term?
Okay, so it is a residential school. There just will be an offer of day placements as well, but primarily it's a residential school. So the idea is that the children, on the whole, or the young people, will be residential there. So that's definitely what this is all about. So it's just that there will be the offer of some day placements as well. It won't be entirely residential, and most schools aren't entirely residential. They do offer day placements, and that could mean that some of the day placements might take advantage of some of the residential for respite and things like that. So there would be a mixture of how it's organised as far as a residential, but the main drive is to have a residential school.
When I listened, I heard there was a small residential part.
No, sorry. Perhaps that was me, sorry if it was. And then we haven't gone any way down the road with the feasibility. All we did was we went and had a look round just to see initially if it was even possible that it would be right for us if it became available, and that was quite a while ago. And we went with Property Services so that because I don't have details of how a building would be adapted. That's not my knowledge, so I took them with me just to have a look round. And all we've done is we've done an internal application to planning to ask them what we would need to do if we were successful in going forward with the school. We haven't done any actual work. Does that answer? Yeah.
In fact, in our recommendations, recommendation 5 is to comment on that commencement. So that ties in with what Rosemary's just said, I think. Okay, the rest of the panel. Oh, gosh. Joe, and then Leslie, and then...
Thank you. It says in 4.8, I must be satisfied that a better use of public resources can be achieved. So it seems to me that the budget is highly important in the decision-making of this process.
I mean, it's a factor. We have to live within our means, and as a council, we have to use our resources effectively and target them where they're most needed. So that is a factor, but it's not the only factor. It's one of many.
Okay, thank you. And following on, in terms of the situation in Charlton House presently, we know that we've spoken about the residents, but we haven't heard very much about the staff. Why does my phone ring at this point? So we haven't heard very much about the staff. Will there be any redundancies taking place?
So in terms of the staff at Charlton House, so we have met with staff and communicated with staff each step of the process. So every time we've done something, so when we were getting ready to publish the member decision around going to public consultation, we met with staff and told them that that was happening and how they could be part of that. When the consultation ended, we met with staff and we told them. So each step of the process we have met with staff and we have told them where we are in the process. So staff now know that we are due to come to scrutiny. Staff now know that we are due to go to Cabinet, and staff have been given links and access to the papers that have been published, and staff have been advised in terms of how to, as members of the public, they could submit questions. In terms of then consultation with...
The question is about redundancies. Will there be any redundancies?
I have not gone into formal consultation with the staff, and the decision hasn't been approved, so I can't comment on that.
So is there an expectation that should you shut down Charlton House, that where will those jobs go to?
So that's that's a question that we constantly are asked by staff as well, because they're worried about that. We have enough vacancies just in our own sector, just in the CRCs and the extra care housing, to be able to pick up all of those 19 staff. And I'm not talking now about adult social care. If I was to talk about the whole council, we have more than enough. There's 19 staff involved, and we would not expect to have any redundancies. That's our position. We would not expect it because we've got those vacancies. But one thing staff have said to us is that they are, some people live locally to Keynsham and they don't drive. And they've been asking us, well, can we have a job locally? What will you do for us? And once we go into that consultation with them, we'll work through that with them. There's about 3, as far as I know, who actually don't drive and need a local base. So we'll have that conversation with them when we go into formal consultation, if that decision gets made on Thursday.
So there is a possibility that some people could lose their jobs?
I can't see it at the moment, because we need more carers, not less.
Okay. And how have you worked with the unions on this process?
We've had a statement from the unions, so we've been working very closely with the unions, in particular Unison, and Unison has made a statement to me and asked me to read it out. It's very short, so we will await any decisions regarding the status of the building first. Then we will look to negotiate with the council regarding any changes to our members' terms and conditions. That's Unison's position on this, and I was asked to read that out by Dave Dixon, who's the local chair of Unison. But we've been working very closely with Unison, but once we go into consultation, if that decision is made, that's when we will work even closer with the unions. But he asked me to read that statement out here today.
Okay. And then, sorry, can I just ask one thing? Can you make sure that Mark has that statement for our minutes?
I will.
And then following from the team here who are saying that they haven't gone about a feasibility at the moment, and then coming back to my initial question, which seems that the budget seems to be an important decision making. If you haven't done a feasibility and it does cost more than keeping it as it is, and then we do that work later, then we're not in a great situation, and we've moved people, we've upset a whole load of people who work there, and there doesn't seem to be somehow a joined up process in this before making a decision this week in Cabinet.
I think it'd be interesting maybe to also talk through how decisions have to be made as well. The process of decisions that you can't preempt.
You mean the consultation, the staff consultation, whichever. I just want to come back to Councillor Wright's comment about not joined up. It's joined up in the sense that we've had those discussions across children and adults. We've seen where the greatest need is, but the decision will have to be made by Cabinet before we can even work any closer together. So for us to know what the decision is, and then we'll work through what will happen with our staff and our residents, and when the building will actually be available for education, if that's what the decision is made. So we are very joined up, and that's why the education team are here to support the recommendation. So I would say we are very joined up. The question about process, I know I've said it already, but just reminding people, we will not go into a formal consultation with staff until after this decision is made.
Okay, but the Cabinet member has also just said that we need to live within our means. So but what I'm trying to say is that we don't know what our means are because we haven't done a feasibility study. So there's a confusion there.
So the feasibility study is on the building and the use of the building. And what will be needed to adapt it, to make it into a school, if that's what is agreed. I don't know if the budget you're talking about is also to do with doing that work, because there isn't an issue. We have 5 million set aside, which I think is more than sufficient for the adaptations that will be needed to the building. We had a bid through our safety valve project. We were allowed to bid for additional funding, and we secured 4 million, and there's 1 million set aside in our high needs capital grant funding. So there's not an issue with the money for the school. That's already sitting there. There's no problem with that. And yeah, the feasibility is literally on the building and what adaptations it will need. They're pulling the architects and the contractors to come in and do the work.
And then just picking up one more thing. So we have an important building, and what we know in terms of cuts across the country is that councils are selling off buildings to make money or to not be in debt. What we could be in a situation where we close down Charlton House, then you decide that this isn't the right thing, and then we're left with an empty building which we then sell off. So, there's all sorts of fallouts from this that I guess as a scrutiny panel we'd just like a little bit more from.
Alison, and then maybe Suzanne.
Yeah, just on the costs, and one of the reasons why Charlton House is expensive as a nursing home is because it's a small unit and we don't have the economies of scale. So we're paying more for nursing placements at Charlton House than we are in other nursing homes in the area. So it's not cost effective to use Charlton House for general nursing. We also know that for the children that we are sending out of area to residential schools, a lot of those are run in the private sector where they have very, very high profit margins and the costs are very, very high. We know that if we provide those services locally, they will be cheaper. So actually it makes sense, both from the costs of running older people's services and the cost of running children's services, to use the building for that purpose. And, we looked at various alternative uses. It wasn't just, no decision had been made, a decision hadn't been made that it was going to be children's services, but having looked at a number of alternative uses, the children's service one makes sense. And I think it's very likely, given the information we have, that it will go ahead, and I think it's very unlikely that we will be selling this building off. And if the children's services didn't go ahead, there are other options that we can consider before we had any ideas about disposals. So
Which sort of brings us back to the original comments that have been made earlier by this panel, that it sounds like you've already made a decision before the consultation, to go through the consultation to make this decision.
We knew that we needed to make changes. We felt we were not making the best use of that resource. We were not providing the best service we could using that resource. So, but in order to make the decision about the way forward, we went through a process. And as I've said, we went in with some recommendations. We then consulted, and we are now proposing some different recommendations on the basis of feedback. So I think, it's wrong to say that the outcome was predetermined. We've been very, very careful to make sure it wasn't, and it wasn't.
Thank you. Leslie.
Thank you. I'm confused now, because what you're saying is that there is going to be a decision made by Cabinet, and following that there will be a consultation with staff. So one of my questions is, how does the organisational change process work if the decision's already been made? Because I don't see how it can be. How does that then fit with the Bain's values about being bold, empowered, supportive, and in fact transparent? You've talked about consultation with staff. How many meetings were held and how many staff were involved in that? Were the trade unions involved as well? What I'm understanding from staff is that there seems to have been managed decline with the closure of the beds. And what's happened is, because staff have become demoralised, that many have left. So obviously that makes that more difficult for the staff remaining. The concern then with the staff remaining now, as we're hearing, is that they may well be out of a job and have to go somewhere else to carry out a job under redeployment. They've got no guarantees of where that might be. Although, Suzanne, you've just said, that there's plenty of other jobs, but it might not be the same job that you were happy doing. And it seems a shame when Baines has put a lot of money into this centre already, and you had a dedicated staff, but they've come into a situation where many have left, and wherever we are now, whatever industry you work in, whatever sector you work in, we are short of staff, absolutely short of staff. And there's lots of reasons for that. I'm not going to go into those now. Clearly there's a need for support for young people with complex needs. I don't doubt that, but there's also needs of these people that are currently in that home. And the CQC report, linking in with the Equality Impact Assessment, I'm not sure that the impact assessment actually covers all the detail. There's great holes in it, in particular with relation to staff. But if you look at the CQC report, while it said overall that it needed improvement, it did actually say that the care was good. So that's the care provided by staff, and they should be applauded for that. The area that does need improvement, not just at Charlton House, but the other two community resource centres, is in the well-led, and that's a concern. And I've not seen reports on that. Where's the action plans? Where I work, you get a CQC report, you put actions into place. So I think we ought to see that. But I am concerned because I feel we're doing this back to front. Decisions are going to be made, staff are going to be told, as has been said several times today, staff will be told, rather than a proper, meaningful consultation where they have the opportunity to have a discussion with their union rep present, rather than to be told that they can go and comment on the consultation for the public. And how are they supposed to understand all the ins and outs if they haven't got all the information and we haven't got the information? Thank you.
Thank you, Councillor Mansell. I have tried to write down as much as I could in terms of your questions, and please do prompt me if I'm not answering them. So I think, as Suzanne and she will come back in has already said, is that we cannot start a consultation with our staff up until a decision has been agreed. That's in line. You asked about our organisational change policy. That is in line with our organisational change policy. There have been at least 4 meetings with staff, of which I have attended. I cannot give you off the top of my head how many staff were in attendance at each one of those meetings, but there has been other meetings to keep staff updated by the head of service and the clinical lead in the home, but we can provide that information if needed. So we haven't included in the Equality Impact Assessment any information about staff. We would not do that in a cabinet item that talks about the impact on the residents. Obviously, we do need to do an Equality Impact Assessment as part of our organisational change process, which we are doing. In terms of the CQC reports, they are 14 to 16 months old now. I would say in Charlton House we came here and we talked to Scrutiny about the inadequate report, which then went to requires improvement, and there's been substantial changes in terms of the amount of leadership and management and support in the structure across those homes to recognise that there were some gaps in that leadership staff team. We did and continued to recruit and continue to recruit for staff for Charlton House all throughout this process. It would be wrong of us to cease any recruitment before a process is concluded. We have a very well stable staff team at Charlton House. I'm not seeing that staff have been leaving over the last few months. We have dedicated and committed staff at Charlton House who we are supporting, and should this go ahead, we would want to support and keep every single one of those staff either within our services or across the system as well. And as Suzanne said, there are a number of vacancies throughout our settings, including those services which are currently being transferred over to us and will be with us on the 1st of April. We are now undertaking, and I've picked up the recruitment for those services given the timescale. So that is opportunities across a broad range. In fact, excluding Charlton House, 12 services that the council run. So many opportunities at all levels of staffing as well. I am sorry, I didn't catch anything else other than that, so I'm sorry if there was other things, Councillor Mansell, that I may have missed.
Leslie, was there more questions that you felt hadn't been answered?
Yeah, so what's the cost of all of this then? So we've got the cost of services to children. So what's the cost to the people currently in the home and the future cost potentially if we're not going to provide it?
See, if we were... Now, the Children's Service haven't worked up their proposal yet because they're doing a bit of work around that. The expectation is that the high-cost placements that are outside of this, outside of that we're paying for would come back, and that would be, overall, would be more cost-effective. For us in adult services, for those 10 people that were to move, yeah, it would probably be much cheaper to move them out into the independent sector, because we can buy beds at 600-700, whereas Charlton House is much more than that per unit cost. So yeah, you'd expect to see across the budget over the next number of years in the council a reduction in overspends across children and adults. So yeah, it would be important to say that. But as Alison has said already, we take cost into it as well as safeguarding, as well as quality of service. It's a mixture. It's not. We're not just driven by the cost alone.
Thank you. I'm not happy, really.
Okay, we'll pick this up, I'm sure, when we're going through recommendations. Kevin.
Thank you, Chair. Two areas of note, really, that for me. One, I think you've answered in all the questions that have already come before, which is around feedback from staff and how you're taking them with you, which seemed to be a crucial part of it all. The other area was around the results of the consultation and the percentage of don't knows, relative percentages, because we're talking of small numbers and everything else to go with it. But it just seemed to signal, when I looked at those, that the don't knows to do with Charlton House and to do with Coombe Lee were relatively higher than to do with Cleve Court. And whether that was around either communication or whether around the final proposals being really clear, just wondered what your thoughts were on those.
You're right in terms of that observation, absolutely. When we looked at the comments that people had made against the don't knows, it was very bespoke to the home that they were talking about. So if it was Coombe Lee, for example, we would often get a comment on, I don't know anything about this one, my comment is around Cleve. So the comments we were getting were very bespoke to the homes in terms of people's knowledge and interest in those homes. There were some wider ones. So I think the proposal around each home was clear, but asking everybody to give a comment on everything, I think, was where it came to some of the don't knows.
Okay, any more comments from the panel?
Can
can I just remind you that I made a promise at the last meeting that we'd bring back the safety valve in more detail, so we'll be able to see how this fits into the bigger picture. Thank you.
Assuming the decision is taken that we expect.
Yes.
Okay. Thank you very much, Paul. Okay, Eleanor.
Very much, Chair. I wonder if I could just make a couple of comments which might illuminate one or 2 points. Firstly, I'm a member of the Planning Committee, and I've been to quite a number of residential homes where, of course, the question of viability and the justification for alterations has often loomed high, and we've had the chance to talk to the management of these homes. And there seems to be a consensus which my local resident who runs the Manor Farm residential home in Radstock and 2 homes in Westfield would agree on, that you need a minimum of 20 beds. It just cannot function economically, viably, or anything else with less, however friendly and nice and, welcoming the home may be. They just can't do it in today's economics. However, what worries me, and I wondered if there was a contingency for this, it's taken great difficulty getting 6 extra studio beds rooms on the Manor Farm, and I think they're just about to be let. What is going to happen if there is a planning problem with Charlton House, which I haven't visited? That's the first point. The second point, we've got in Keynsham the Chocolate Quarter facility. It's not Keynsham, but it's very close, the Saltford home, and now the new one at Pixash Lane. But I'm not sure that they cater to the same economic range. They look rather superior to me, but that's something else to bear in mind. Are we removing a sort of lower end of the market provision, as it were? But finally, I missed the bus, didn't I? And I do apologise for coming in late, but this gave me the opportunity to spend the entire bus journey talking to Sam Plummer, the CEO of South West Connect, who was on the bus, and he read the report, and he's very much in favour, strongly in favour of what you're trying to do for the severely disabled, with whom, of course, he's very familiar, and also he's familiar with what provision we've got in the Soma Valley, and it's just not adequate. So for all kinds of reasons which have been outlined on my left, he gave those as being why he would like to see the recommendations go through.
Thank you. I don't think you need to comment on all of that, but I think the point around provision for different levels of sort of income, I think, would be important.
I think that's really important, because there are we've got between 60 and 70% of people who are self-funders who can buy at a very expensive rate. But of course, sometimes what happens with that money is that they're in for 3 or 4 years, and then they've lost their money because it's been so expensive. We know of one up the road which is £3,000 a week. So what happens then is the people are in there for 10 years and then they have no money. So we as a council will step in and support, of course, but they can't then stay at £3,000 a week. So there is an issue there, and we have a responsibility within the market to try and make sure that it's competitive, but that but there are different economical bands, if you like. We have a range of care homes, some at the higher end, some medium, and some that are a little bit cheaper, but actually cheaper doesn't always mean bad quality. I have some homes that we've got safeguarding issues with, and we're paying, and they're very, very expensive. So it doesn't actually mean just because you pay a lot, you get a good service. Sometimes the buildings may look well, but the care may not be as good. So, for us in Charlton, that was always important for us to be able to work across that service. But yeah, I don't think it would be taking that much out. We still have plenty of beds within the service to be able to, within bins to manage.
Thank you, Suzanne. Thank you, Eleanor, for bringing that point up as well. So any more questions? If not, then I will move to the recommendations. I'm going to go through them one by one, and I will give you the opportunity to speak about that, the recommendation 2. So the first recommendation is to develop Cleve Court Residential Home into a centre of excellence for dementia care without nursing. Does anybody wish to comment on this, or shall we just vote on this one? Okay, so all those in favour of this recommendation? And obviously 2 of our panel members are not voters. Thank you. So the second recommendation is to enhance our offer at Coomley Residential Home to enable younger people with more complex needs to remain closer to home. I think I'm right in recalling that younger people is not in the sort of children and young people category. They're just younger perhaps in comparison to other residents. Okay, thank you. All those in favour of that recommendation? Again, that looks unanimous to me. So the third recommendation, to deregister the remaining 10 places in use at Charlton House Nursing Home and then develop the site to provide a residential school for young people with complex needs. Are there any points people want to make on this? And if, I'm slightly preempting what I think the vote will be on this, but if this is not something you would recommend, perhaps somebody might wish to be thinking now about an alternative form of words that would be sent to Cabinet. Okay, so all those in favour of this course of action? Okay, right, all those against this course of action? Okay, that seems like the majority there. So do we have an alternative course of action that we would like to recommend?
I think are you looking at me?
I am looking at you.
Regina. I do feel we haven't been given enough information as to why Charlton House should be closed. I think we do need more capacity. I know it's been said there is sufficient capacity in the system at the moment. I just feel very unhappy about the way the process has been conducted. And I mean, I do feel the decision was already made before it actually went to consultation. I don't know if anyone disagrees with me. Anyone wants to add anything to that?
Leslie, you look like you're about to add something.
I think 4 words would be around, we'd like to see more information and detail, including costs and the data, before a decision is made.
I suspect that the decision will be taken at Cabinet, regardless of our thoughts on this. I wonder if it would be helpful, if that is the case, if the decision is taken to close Charlton House, that a further report comes to this panel for us to see how, for example, the staff consultation is worked through, and also around the point that Suzanne made right at the beginning of the future provision for those 10 current residents. Would that be helpful? Yeah? Some. Okay. So can we, would you like to support that panel? All those in favour of that? Thank you. Okay, so that's majority. So, and then the next recommendation is to offer community groups and charitable organisations use of the day centre spaces at the community resource centres at a reduced rental rate. All those in favour of that recommendation? Okay, thank you. And the final recommendation is to commence a full feasibility study in relation to the expected change of use for Charlton House to a residential school. So I think that fits in with our proposal, looking at recommendation 3. So all those in favour of that?
Sorry, Chair, could you Could you clarify that for me? Are we saying we don't want to commence a full feasibility study because we've already said we want Charlton House to stay as it is?
I think what I had said was, assuming that the decision to close Charlton House is taken on Thursday, that we would want to see a further report come to us about the points that have been raised around staff redundancies, around the residents moving, and this then is it's sort of aligned to that. It's that second piece of work about then the future of Charlton House itself as a building. I think if we assume that decision will be taken, we would want to know what will happen to Charlton House, and if we would want to know that it is feasible to change it into a residential school with indeed day places as well. Is that clear, does that or not?
It is clear, but it's yes, we're going to agree that the decision's already been made, and therefore this is what we're going to say. So. Ruth has got her hand.
Ruth.
Yeah, I was just thinking, I was sort of asking about the process really. So there are 5 separate recommendations, but 5 very clearly is linked to 3. But as I was, and what happened with my vote? So for 3, I was in favour, but the majority was not. Does that mean? So in a way, does that mean we don't vote?
It's an indicative vote because what I was seeking was it's sort of that feedback mechanism, the feedback for the cabinet member, so she can get a sense of support or not support.
Okay, well in that case, am I allowed to say I am in support of recommendation 5 because it follows on from recommendation 3, so it would be logical. I would like that noted that I would support commencement of a full feasibility study.
Okay, so, and I think assuming that decision to close Charlton House is taken, perhaps I can add that in for our purposes. So, assuming that decision is taken to close Charlton House, would we be in favour of a feasibility study taken for this use for a residential school? Is that more helpful?
Yes, Chair, but can we change the recommendation? We're changing the recommendation, aren't we?
We're giving feedback on the Cabinet's proposed recommendations. Okay?
I think I understand.
So would we be in favour, assuming that decision to close Charlton House is taken, of a feasibility study being undertaken? Yes. Okay. You can abstain, that's fine. All those who are against, and any abstentions? Okay. That's duly noted. So this is more for the Cabinet members' information. Right, so thank you. Would you appreciate a 5-minute break now? Yes. Okay. Let's have a 5-minute break. Transformation Programme, which is for noting, but I suspect there may well be some comments that we would like to raise. So, Alison, do you want to introduce this item for us, please?
Okay, thank you. This paper provides an update on the Community Services Transformation Programme, which has been implemented following the decision taken by both the Council and what is now the ICB to not extend the community services contract with HCRG Care Group beyond the 31st of March 2024. The programme of work has been split into 3 separate but overlapping work streams that are coordinated by a programme board. And the 3 work streams are, and we've covered all this before, so hopefully this is all familiar to you, it shouldn't be news. Firstly, adult social care redesign and community partners, and that is led by the Council. And it was in this work stream that we had previously taken the decision that we were going to be reviewing all the community partner contracts next year, which we referred to earlier. The second one is the public health work stream, and that is also led by the Council. And the third one is the integrated community-based care, which is led by the ICB, and that's led for both children's and adults' health services. So this paper provides an update on progress, which includes the detailed work that will result in adult social care services being provided by Bath and North East Somerset Council from the beginning of April 2024, so just in a couple of months' time. And the measures taken across the other 2 work streams to develop commissioning intentions and to ensure continuity of service during procurement processes. And now I'm going to hand over to my colleagues on either side in case they want to add anything more, or we can just go straight to questions and they can help with the answering.
So I'll be very brief. I just wanted to say that HCRG have worked really closely with us on this transition, and it's been really important to note that. And when I came to Scrutiny way back in, I think, November 22, we talked about the quality of HCRG service, and they've continued to deliver right through this transition and been very supportive of the transition. Just a reminder that it was May 2022 that the decision was made. We have 240 extra staff coming in, so that means 2-day services, social workers and social work assistants and some administration, an employment service and shared lives as well. So it's a lot of work. We've got a dedicated team who's supporting us in that, supporting us in the transfer. A key point for us now, everything is going okay. We've ordered the computers, they've got their emails, we've got the buildings, the staff know where they're going on the 2nd, I say the 2nd of April, not the 1st, because the 1st is a bank holiday. The last thing now we are waiting for, and we have to wait for this for 28 days beforehand, they will send us a list of their staff where TUPE will apply. But that only happens 28 days before they're due to transfer. So we're waiting for that, then all the work gets completed. We've got an engagement plan and a communication plan, and on the week that they come, all the managers will be available and on site and not generally doing meetings, so that they'll be there to welcome the staff in. Will, our Chief Exec, Will Godfrey, is also making himself available to see all of the staff and welcome them back. We are really excited to be one council again, and the feedback from the staff is that they're happy to be coming back as well. Worried about all the different processes and what it means for them and how that's going to work, but generally the feeling is very good from the engagement. So Alison and I over April will be working and meeting with them in different groups as well, so we'll go out and meet them. They're on 5 different sites. The majority of them will come back into the Civic Centre actually, and that will be cost effective for us. But that brand of Baines Council is really important because the culture will change for them. So we're quite excited about them coming back. So the biggest issue is the TUPE and how that moves forward. And I'm sure Becky will talk a little bit about public health. I just wanted to say about the health service contract. We've got a direct award which starts on the 1st of April this year, just for 1 year, around our health service contracts, which includes our community services. At the end of that year, then, there's work going on now about the procurement of community services across BSW. So there's very little we can say in this space at the moment because we're in commercial sensitivity, but actually the ICB is leading on that. So there's the 3 programmes. And no doubt we'll come back and let you know how we've got on in April, May time. So it's really great news for us.
Thank you, Suzanne. I don't know, Laura or Becky, if you wanted to add anything at this point.
Not from me, thank you, Chair.
Similarly, just happy to take any questions. Thank you.
Okay, panel, any questions? Kevin and then Liz and then Joe.
Yes, thank you. A lot of information. So, which probably reflects the amount of work that we're having to put into it. And this is from a very naive point of view because obviously you live and breathe it, and I've only sort of come into an outside contact. But I believe that the last time we had an update on this programme, there was a sort of a key to-do thing was around the framework that surround the social work element, and that was going to be revised and ready for all the new staff. So my question was, how's that going? Has that been done? And the other 2 questions I've already raised about the community hub, and I don't know whether you want to say any more about that. But the other 2 questions are around, with all the budget pressures, are there sufficient resources to achieve what you hope to achieve? And lastly, what are your key areas of concern remaining, if any?
The new operating model, so that is in place for when the staff come back, but what's the most important thing is that they come back and they do the same jobs as they're doing now. So it's all about a safe landing for us. We've agreed with them that the development of the framework, as you call it, the operating framework, we have a proposal that we'll work with them on then and consult formally at some stage. But it's all about coming back to the council, landing safely, being on their computers, being able to see the people that they support, and be able to be in the right building and get paid. They're the sort of things that I worry about. We've got very good measures in place, and payroll have been fantastic, and are just waiting for the data now. I think that probably keeps me awake is that the hidden costs that I don't know about. I don't think there are any, but I do worry that there's hidden costs. When the CRCs came back, that cost us 2.5 million extra as a council, and we had invested a lot into that. So yeah, I'm always worried about hidden costs. I think because we've been very diligent. We've had an audit recently as well of the work that we've done. I'd be surprised if anything came back and that I wouldn't know about, but that's my one fear. That would cost more than the money that we have. We do know that even bringing them back, bringing all those staff back, means that there's an extra cost to our corporate overhead. So our finance, our HR, our IT, because they're dealing with more people, and that money is not in the corporate overhead at the moment and has to be put back in. So that's a pressure for them. And we also have a pressure because there will be uplifts, and we need to manage the uplifts, and that we're thinking that pressure will be about £1 million on top of the 1.3 we have to save overall. So it does put a greater pressure on us, but we're aware of it and we've got a plan for it.
Thank you, Suzanne. Liz.
Thanks. Firstly, I'd like to look at the public health update, and thank you, Suzanne, for all the work you're doing, and it's really good to know people are going to be paid when they start on the 2nd of April. That's really good. But the one thing I want to ask about is what will the impact of the coming budget cuts on the modelling done to date? The top risk identified with public health is associated with available funding not being enough to cover future service delivery requirements, as all future commissioning needs to be covered by the public health grant. Forgive my ignorance, is that the direct award grant? And Becky, as you're going to come in now, you did mention at one of our meetings that the public order grant the public health grant was ring-fenced, but 200,000, some of it is ring-fenced. Some of it, 200,000, which is ring-fenced, is going to be used elsewhere. So would you mind answering three questions in one, please?
Yes, sure. And if I miss anything out, please do come back. So so the public health grants to every local authority is called a ring-fenced public health grant. So it comes along with particular conditions and guidance around what it needs to be spent on. So there are some services within that are mandated that we have to provide. So we have to provide sexual health services, we have to provide NHS health checks, advice back to the NHS, some health protection functions, our health visiting services, the health visiting mandated checks. So there are a number of set services that we have to provide, and so that's clearly set out in the government in the guidance. The funding, because it's ring-fenced, means that it has to be spent on achieving public health outcomes for the council. And so that's where the conversation last time came around the 200k. So I am fully assured that the funding that we are, the programmes and projects and the costs that we are funding using the public health grant for are achieving public health outcomes. That's not to say it's going to be easy. So a colleague asked about a tight budget. It is a tight budget. The grant does not increase in line with inflation, doesn't increase in line with staff pay awards, with contractual uplifts when we come to re-procure. So it is a tight budget. So we are having to look at, and that's all part of the business case process that we've been going through, making sure that we are getting value for money, that we are covering our mandated requirements, that we are using evidence of effectiveness to make sure that we are funding services and programmes that we know have a strong evidence base about them. And we will need to cut our cloth. And that's where we are with every single grant in the council. There's nothing unique to the public health grant in that way. So that's the process we've been going through with the business cases. And we're continuing to do that in very close alignment with Programme 1, because our community partners that we fund are funded through, there's a very strong link to the community partners. So we have, within the public health grant, we fund a number of services. Some of those, 6 of those, are part of the Community Services Transformation Programme. So Programme 2 is concerned with 6 of our services. Not all of the services are contained in that big transformation programme. So, for example, our contract that we have with the RUH to deliver sexual health services, genitourinary medicine services, that sits outside of this. 6 of our services, which is the bulk of them, are part of this programme.
We don't quite have enough money, but you think we're going to cover most of the things within public health that we have planned for?
Yes.
Right. No, nice simple answer. And one more question, if I may. It's really good to see the Community Wellbeing Hub in place, and we'll carry on with this triage work, and it's front door for prevention and early help support. And it's going to carry on until April 2025. So what happens after April 2025?
Yes, so there's work going on at the moment, which colleagues referred to a little bit earlier as well, to try to ensure and find sustainable funding for the programme. And that's some of the work that's going on, to look at what would a core community transformation, a core community wellbeing hub look like, which can then continue to develop and build in the future. So we are working hard with our NHS colleagues and with adult social care to develop and to think through that. Colleagues from third sector organisations have been heavily involved in that. And Kate is part of that group that's been heavily informing those discussions around what the future of a community wellbeing hub could look like, what are the key functions that we'd want to keep in it, how can we really do that in a way that is sustainable and affordable at this current time.
So who will be funding it?
We haven't got we're working at the moment to develop a delivery model.
I was going to add to that then, so is it possible, is it even allowed that some of those services could be funded through the public health budget?
So there are different elements to the Community Wellbeing Hub. So there is the partnership element, which isn't funded, it's not commissioned. The bits that are commissioned are the triage service. So that's the way in which referrals come through on the telephone. And then from a public health perspective, if members of the public are triaged through the triage service and need and want some public health services, then they are referred through to the Wellbeing services, which are funded by public health. So the triage service is largely funded at the moment through the public health grant already. So that provides both for the wider partnership within the Community Wellbeing Hub and the very specific wellness services, which are our Healthy Weight, Stop Smoking services particularly, that are funded through public health. Does that help answer?
Thank you. Yes, nice and clear.
Thank you.
Okay. I think, Joe, you're next, and then Leslie.
Hi, thank you. 341, the Health and Social Care Act, you list a whole load of things that we are meant to be doing, and I guess my question is, are we doing enough of them, and are we resourced enough to do them? And if not, which ones are we failing on the most? So public health, nursing services, substance misuse services.
I'll come back to that. Yeah. So we aren't failing on any. We aren't failing on any. We have a very good and high quality public health nursing service. We've got some excellent substance misuse services, our NHS health checks, our wellness service. We aren't failing on any. Budget is tight, though. I can't say that it's not tight. So we're going to really be needing to be looking at within those services, what are the core parts of each of those services that provide the best outcomes for our population, that have the best evidence behind it, and which are statutorily required.
So let's pick up sexual health services. There does seem to be some issues around young people at the moment. I don't know all my diseases, but there is stuff I hear. So I guess when you find that out, how quickly can you respond to that, and therefore make sure you have the allocation of funding in those spaces to then deliver for those problems?
So we will be commissioning, so these sexual health services in particular relates to general practice and pharmacies. So this is to do with the provision of long-acting reversible contraception, chlamydia testing, emergency EHC. So we will be commissioning for outcomes with our services, and part of our service specification with our providers would be an expectation around flexibility if there is a particular need in a particular area that is part of and fits with the service specification.
Okay, thank you. And then children's safety equipment. Can you just explain 345? It means nothing to me.
So children's safety equipment is things like stair gates, fire guards. So that's a service that we will be bringing back in-house. We'll be bringing so HCRG have ended the contract with the current provider. The funding is going to be coming back into the council, and we're just doing a review at the moment to find out what other organisations already provide equipment for families with young children around safety.
Okay, all right, thank you. And then 5.2, the budgeting pressure of 1 million. Could I hear some more on that one?
So that's the one where I was talking about earlier on, there's a pressure on budgeting and transfer the staffing.
Okay. All right, okay, thank you. All right, thank you very much.
Thank you. Leslie.
Yes, thank you. It's been an interesting read. Could I ask that we have an impact report at some point to see what's actually coming out of all these initiatives? Because there's lots of talk about what's happening, which is great. But it'd be good to see what the impact is, and especially on different equality communities. The other question I'd like to ask is, Suzanne, you just mentioned the Baines brand. Can you explain what the Baines brand is?
I was really speaking about the council and our core values and our principles that you talked about earlier on. They'll be different from HCRG's strategic intentions. And that'll be, it's very important for us that the staff feel welcome and welcomed into the council in a way that they understand what the council's about, how we work, because there will be different procedures for us compared to how HCRG work. Their main base, I think, is Liverpool, and they actually work very much on they don't have the corporate services that we have in the council, so it will be quite different for them. And culture is a big thing, and we've got a whole training plan in place for them as well, for when they come back, and how do they use all the systems, all the systems that we have, which are different from HCRG, different sign-offs, procedures are totally different. So there's a whole 2-3 months training that we've developed for them, and to meet the executive team, meet the political team, understand scrutiny. They haven't been involved in any of that previously.
Is it possible then to do a report, as Leslie suggests, on the expected impacts on those various equality communities?
At this stage, I don't see any difference to the residents, that there should be no difference. What we could do is, I don't want to offer it before the move, because I know for the month of March and April, it'll be all about supporting the staff who've transferred across. We can do something later on the impact, if that would help. Okay. I wouldn't want to do it beforehand, because I don't know what the impact will be, and I think there'll be a lot of learning from this.
Okay, well, we'll put it on our future work plan then. Thank you. Okay, any other comments from anybody else in the panel? Just always checking I haven't missed anybody. Thank you. Well, thank you very much for all the work you've been doing on this. I know it's been, perhaps unexpectedly massive for you. So thank you. So moving on to physical activity, implications for public health. As we know, public health now oversees, rightly in my opinion, leisure. But I will ask Alison to introduce this item, and then I think we'll move on to Becky, Martin and Chris. Thank you.
Okay, so this update paper was requested by this panel. It provides information on the range of physical activities and leisure services available across Bath and North East Somerset, and the health benefits of such activities. That's all I'm going to say. I'm going to hand over to my colleagues in public health to take us through the detail of it, but certainly I was very encouraged in a way by the number of services there are and the number of people that they touch. I'm sure we can always do better, but actually I think we're doing quite well, which I was pleased to see.
Thank you. Becky.
Thank you. I'll just say one sentence before handing over to Martin. So leisure services moved into public health and prevention in 2021. And it's been an absolutely excellent move, that join up between the holistic benefits to adults and children from physical activity, and joining that up more widely with public health has been a really excellent move. And because Martin coincidentally was already in the council previously, he already has really strong links with the rest of the council, so is able to bring some of those very specific leisure-specific, facilities-specific links with him, which has also been to public health benefit. But I'll hand over to Martin. Thanks.
Thank you very much. Yes, it's been interesting actually putting this together actually when you start to look at the landscape within Bath and North East Somerset. And I want to thank Chris for helping with that. Chris is relatively new to the council, and it's actually been useful for him actually as well to start understanding what's going on and all the different partners that we work with. It's quite a complex beast sometimes. Leisure gets sort of lumped with quite a number of other things, but and we do have a sort of commercial side, which is the leisure contracts and that side of things, but also then we have the physical activity and prevention and promotion and health sides as well. I will say when I started the council 24 years ago, I was employed as what was a sports development officer then for hockey, which was very, very narrow remit about what we did and how we did it. And we had a budget for developing hockey specifically. And since that time, over those years, the transition has been monumental in how things have changed around where sport, not necessarily the driver, but physical activity is now the driver, and the benefits of where physical activity can impact on such a wide range of different outcomes for residents within Bath and North East Somerset, and what are the wider implications having a physical activity element can bring to public health as well, because public health has been fantastic for us as a service to actually sort of promote what we're doing and create those links, and even to the point now where I've been enrolled on a Masters in Public Health as well, so I'm learning a little bit more about the intricacies of the public health sector and how it works together, which has been really interesting for me as well. But I'm hoping that the report gives you a flavour. It probably doesn't capture everything. I know it doesn't capture everything, but we'd certainly be open to any questions or any clarifications that you'd like to make or have.
Thank you very much, Marty. I don't know if Chris wanted to add anything, or are you happy with what the boss says?
I think Martin very ably covered it all. Thank you.
Okay. Thank you. Okay, so over to the panel for questions and comments. Kevin.
Yes, thank you. As you say, there seems to be a lot going on. Three areas, please, for your comments. The first one is, what do you see as the barriers to participation in being active, and how are they being overcome? The second, where or what do you see as the gaps in provision, if there are any? And thirdly, what are your key priorities for the future? And are these being funded?
Okay, thank you. So I've got the three areas there. So barriers to participation, I think we did a little bit around this. It does vary a lot depending on sort of where you live and what background you have around where physical activity lands. But overall, within Bath and Somerset, we're doing quite well. But there are key areas where we recognise that, especially from an inequality side of things, there are certain populations that are struggling to be as active as they need to be from the Chief Medical Officer guidelines, which is set out. And physical activity can be. It doesn't mean about just being in a sports club, or that's what it can be. Anything around standing up, washing up, walking, gardening. It's got a very wide range now. I mean, and any level of increase in level of activity does have an impact on wider outcomes for health as well. But there is definitely a disparity between within certain areas within Bath and Somerset, and we are working with community groups and organisations to try and tackle those. There's some detail in the report around some of those groups that we're working with, such as the Bath Football City Foundation and some of the work they're doing, and Chris has been working very closely with them, and we work on a number of programmes helping them to find either locations or connections, working with specific groups within the area. But the other one is coming more and more is cost is an issue for a number of families, especially around how you become active. You don't have to pay money to be active, but it does help to be able to access certain facilities. And with the cost of living crisis, it has an impact on certain groups. Gaps in provision, there are certain areas that maybe don't have as many leisure facilities as such, but they are areas that also have other assets as well that maybe aren't exploited as much as they could be. So certain outdoor spaces, green spaces that could be developed more, not developed as in enhanced, so that they're much more open for people to use and to be active in. And that's something that came out from the pandemic as well, the sort of enjoyment of green spaces and outdoor spaces are relatively low cost, but are they welcoming? Are they areas that people want to go to? And that's part of the sort of key priorities going forward. We are looking at potential. We're working with our green infrastructure team to look at different areas within Bath and Somerset. We are also looking at potentially how we maybe look at play as a way of developing long-term healthy outcomes, and trying to encourage active play and the spaces being able to available for play, and having a more strategic look at that as well. Does that answer some of those questions?
So am I right in saying then that your key barrier is really cost?
It's a factor. It's not always the only factor, but it is something that's come more relevant to people, especially for family activities, trying to create that balance between accessible facilities and also the economics of running those facilities as well. How do you balance that? That's something that we wrestle with as all the time. We do have very good relationship with our leisure providers, such as GLL, who run our leisure centres, our council leisure centres, but there's also, we work with the Dragonfly Trust as well, who run Midsummer Norton Leisure Centre, who are doing a fantastic job out there and investing in those facilities for the community. And recently we worked with them on their sort of in putting in a community garden and outdoor play spaces, enhancing those. including helping with them funding bids, that sort of things. So there's quite a mosaic of what we can do, but cost is only an element of that. It's not always cost. It doesn't always come down to that, but it is something that's become more relevant as fuel costs go up. Places have to cost money to run. Leisure centres cost more to run, but we've managed to just about keep prices as low as possible through different measures.
And can I just, the last thing you mentioned about your future priorities around looking at different areas and play, do you, in terms of resourcing, in terms of how that looks, do you need people on the ground? Is it advertising? Is it using certain staff in certain ways? How do you get that message around?
Resourcing-wise, you're looking at the physical activity team, so we are relatively small, but what we do is work very closely with those community partners, which I think is summarised in that report. As far as what we need, we have been very creative and innovative at how we find resource to do things, and probably one of the key ones is going to be going forward is the leisure contract we have with GLL, which actually over the next few years will pay us, or the council, more funding, which might be an area that we can look to use, but also other areas that we're looking at, creating spaces that are sustainable but also wash their face financially as well, and maybe generate some income, looking at opportunities that way. So that's quite unique for public health, that they're normally sort of contracting out things, but actually if we are having leisure, it creates some interesting conversation between myself and Becky and how we balance that and the sort of and being vulnerable to commercial side of things as well. But it does provide some opportunity for us to develop some and come up with some different ideas and bring in people from outside to sort of create some quite innovative solutions as well.
Thank you. And I know Becky put her hand up just then.
Yeah, thank you. I just wanted to add just a couple of things to that full answer that Martin gave. One of the advantages of being in a small council is that it's much easier to work across council. So Martin works very closely with the Parks team, for example, which sits in a different directorate. So thinking around play and children's play, there will be conversations going on there about how can the excellent work going on in Parks, how can we perhaps look at that in a slightly different way with a leisure services or a leisure and physical activity hat on, and is there anything we can do there? The other thing I just wanted to mention also is around the local plan. So again, a huge benefit of having leisure services in the public health team means that the work that a colleague in the team would have been doing with local plan colleagues to look at how can we maximise opportunities in the local plan to improve health is that we can more specifically now look at how that can link to physical activity. So thinking about active travel, neighbourhoods that people feel safe to move around. It's not to say that there are always easy solutions to some of these, but it's bringing that conversation together around being physically active and what will our spaces look like for our future generations to come through the local plan policy work. Thank you, Chair.
Thank you very much, Becky. Jo, and then I've got a list, Ruth, which I've added you to.
Thank you, and thank you for actually mentioning active travel, because that isn't mentioned in this document at all. 3.7, it talks about 3 important partnerships, but it doesn't, why is the Journey to Net Zero transport strategy, or currently what's in development, the Active Travel Master Plan, not mentioned here? Active travel can play a very important role in integrating physical activity as part of people's daily routine, including how they get to school. So there was no mention of that in this document at all. 3.9, how are we ensuring people of all ages and abilities can travel to leisure facilities in an active way? And again, because we don't have the active master plan, we aren't ensuring that people are actually getting to the leisure facilities in an active way. It's a fact that girls are less physically active than boys and don't take part in sports, which are pitch-based. And a lot of the document was about group sport, and there's an awful lot of people who want to take part in activities that don't want to be involved in group sport whatsoever. Skateboarding was something that I championed for years because I recognise there's a huge number of people that don't want to be with other people but yet want to be active. So how are we ensuring that those people, and particularly girls, have the same opportunities to be physically active as boys? Park Run, we know that the present Park Run in Bath is on top of a very high hill, so the only way to get there for most people is to go in a car and then take part. Why aren't we actually making there a park run at an accessible lower level for other groups of people, or several of them? 3.11, what is being done to keep charges low for family leisure centre activities such as family swim or trampolining? Lots of families prefer to drive from Bath and North East Somerset to another area to access leisure centres such as Longwell Green because they offer similar activities for a lower cost. What are the barriers for attendance for the HAF programme? 72% is low for free activity. What can be done to increase the attendance rate? 316, play. There really needs to be more about play and what play is and what play can look like for all ages. And in 8, on the climate change, there is nothing about how travel to leisure facilities is an energy use. So if we are actually to get people to the leisure centres and reduce our climate issues, then we need to make sure that that is put into the notes of this. Following on from that, we also have issues in North East Somerset where parishes aren't able to invest in huge amounts of money to install equipment in local play areas because they don't have the 100,000 plus that is essentially needed. So how are we working with parishes to ensure that play is in their local areas, which can be properly supported, and that local people don't have to travel out to make sure their children play? So I think for us there was a lot of stuff, particularly, and I'm not trying to be political here, but in the Green Group, that we felt that this document needed to have more of and didn't have, and that there was a better way of thinking about activity, and it missed huge groups of people that aren't active, and therefore causes us health problems. Thank you.
Did you get all of that?
Thanks, Joanna. That is a comprehensive list, and you're right to mention about the active travel around leisure. It does have an impact, and it is something that we work with our providers on providing travel. They are encouraged to provide travel plans and facilities for people to be able to access the facilities, not having to drive. However, there is a reality around a leisure centre in the centre of town and how do you get to it, especially, and having being able to access it as well. So unfortunately there is a sort of a balancing act to have with that. But we are working very closely with those leisure partners to try and encourage them to work on that behaviour change with their members, and trying to encourage them to do that. So, and also working with where we have active spaces. For example, unfortunately, when you have sports teams coming together as well as the group activities, they tend to come from regional areas. They have to come, they drive, for example, play football teams, etc. So what we are working with them is on, can we get the communication out there? Actually, can we encourage people to car share rather than everyone bringing a car? That sort of thing. So there are some measures going on there. You mentioned about the active travel, that we did, although there is obviously a big area of active travel, we did talk about the Active Way project that we've been involved with in the field activity side, which obviously I missed the Summer Valley area, which is a clear element that we linked. But there are other elements we probably haven't covered here, which we could pick up and do more detail on. There are family memberships being introduced at leisure sites, and there are family member options. So as far as the cost, to keep the cost down, those are things that are coming. They've been introduced in Midsummer Norton. They will be coming into the GLL sites as well, family memberships to reduce that cost to families for being active. And there are also a range of different memberships that people can access that will allow them to access those facilities for less as well. Concession memberships, there's a requirement for those. So those are in there as well. So we are trying to get that balance right. I think you mentioned about the funding for parish councils, and probably the major area for that would be the SIL funding. It's quite, a dark art how that's allocated to a certain extent. But we have been working quite closely with the Bath Neighbourhood SIL schemes, and we have also worked with strategic SIL. So we have been managed to lever in quite a lot of funding from those pots of money into leisure sites and leisure services. So We've recently supported Bath BMX to help them with their upgrade of the BMX facilities at Odddown. We're working with Salford Tennis Club around getting LED lighting onto their site so they can then have more activity on their site as well. And we're also working out in Ridlington providing LED lighting and upgraded facilities out in Ridlington as well for tennis provision. So there's been a number of different options, but obviously the parishes have their own allocations and we try and work with them to do that. It's slightly complicated within Bath because of the neighbourhood still and where the boundaries sit and which. So, for example, Lansdowne sits outside of Bath, apparently, and that then sits in Chalcombe, which is an interesting conversation we've been having with Dave Dixon and how we create those connections between those two, because it's Bath neighbourhood still can't fund anything outside of the Bath area. So that's been quite an interesting conversation to have as well. So we're working with colleagues to try and work for solutions around those parish councils and being able to add to the amount of money that they get as well from the strategic still. The holiday activity and food programme, obviously that's a programme we don't necessarily run ourselves as a commission separately within the public health team, but obviously does have an impact on young people's physical activity levels, especially in holidays, and offering good sort of warm food as well as part of that. The take-up is always, and the promotion of that is always, you can offer it, but not everyone takes it up. And so actually the result those standards, they've got about 75%, actually is quite good for this, and actually it compares well with other areas. But also we can't force people to go and take up those spaces, so that's probably where that fits. But there is a lot of promotion going on around that and trying to encourage, and the local providers have been engaged to try and help them do that as well, and working with them to do that. And then you mentioned about the sort of the imbalance between boys and girls and activity levels. Again, it's something that we are working with. We're working with a number of football clubs to encourage, on the back of the success of the women's football programme. And it seems really much more popular at the moment, and we're providing women and girls activity programmes up at Lansdowne, which is relatively new. And we are maybe looking at options for working with different organisations like Bath City Youth, who do provide, Bath City Football Foundation, who are providing girls activities, but also we work very closely with the school sports partnerships in Bath and Somerset to provide much more activity, either individual activities or group activities for girls as well.
But it always seems to be that you come back to group activities of sport being about football, rugby, cricket, and what I'm trying to say is that a lot of people, and particularly gendered girls, don't want to do those sports, even if it is successful, and I'm not doubting that there is a group of girls who should be encouraged, but there are a lot of people who don't want to take part in group activities. I know with my own sons, they didn't want to take part in group sports. So it's not just about gender, it's how do we encourage to make sure that those spaces are available. Again, I know with skateboarding and thinking about the local plan, an awful lot of space is designed to make sure that people never skateboard in public spaces. If you think about how all the design outside the train station has been designed, it's to get rid of people doing any kind of activity. So we really need, if we want people to be active, then we also need to make sure that the landscape allows for activity, and that is a really important element of this work. So I would encourage there to be greater conversation on that piece. Thank you.
Thank you. Just one element, I think, where we have seen a lot of success is actually in the female cycling, and especially through using the Odddown cycle circuit. And although it's often done in groups, actually individually, we've had that programme was built from under 16s upwards, and we've had lots of different groups of women and girls coming up and taking up cycling for the first time, giving them the confidence and skills to then be able to cycle on roads or actually compete racing or just be active on the cycle circuit. Those types of bespoke programs are something that we are working with. Unfortunately, we didn't maybe capture it all here, but we could certainly. There are certainly other things that we can be doing as well. So thank you.
Thank you, Dave.
If I could make two comments, really, I'm not sure I have questions as such. I could just echo the use of parishes being proactive about using their SIL money. Certainly in the Chew Valley ward, I've not heard any complaints from the parishes about needing, 50k for the play areas, because they've successfully and used their money over time. My second comment really goes to page 73 of our slide deck, section 3.9, regarding the facilities at the Chew Valley Leisure Centre, which are now operated by Chew Valley School. What that sentence doesn't actually say is that the dual-use facility at the school is now closed and was done 2 years ago. On budgetary reasons, fair enough. It was by far the most heavily subsidised facility across the patch. I get that. But what that does mean, that the school is now working in partnership with the larger clubs. So you have to be a member of the rugby club, the hockey club, the tennis club, or the badminton club to use the facilities there. And those, my last time I checked into it, were the only facilities that were being offered. So the squash club's closed, the football club is threatened. There's no ability to use five-a-side on a casual basis, or the AstroTurf on a casual basis. Certain exercise classes that we used in the sports hall can no longer be done because you need a large space. Now, some other things have gone to smaller centres, such as smaller little spaces, such as yoga, for instance. So there has been a loss of individual and casual user base and certain sports in the Chew Valley as a result. I don't know if you really have any answers to help with that provision, because things like active travel in the middle of winter in the Chew Valley from Nemnett, Throbwell to whatever, it's just not a goer. There are no buses. Westlink is failing. So I think we have some problems out here that perhaps you're aware of, perhaps not. That's all my comment, really.
Thank you, and noted about the Chew Valley Centre. It would be interesting to do some more work with what that provision how that could change, and hopefully work with you to do that. So, but it is noted that the school maybe didn't do what we necessarily expected when we looked at the transfer. That they did say they would operate it as a dual-use site, but I think they changed they changed as it moved forward.
Yes, I think because I was involved with this 2 years ago, before as a councillor. I think the element of risk, particularly to funding staff to run the centre as a dual-use facility, was a big problem for them.
Okay, thank you.
Thank you, David. On my list, I have Liz.
Right. Hi, I'm Liz over here. Just to say, Martin, one could accuse our strategy for physical activities and leisure services to be very Bath-centric, and I'm answering this myself. Maybe it's because we have, it's the largest of our urban settlements in the area. But I just wonder, to what extent, I represent a ward called Poulton in the Somer Valley, and to what extent are you working with parish councils and activities and clubs to organisations and clubs to increase the opportunities for physical activities and leisure services in our area? And one example would be the holiday activity food scheme, which came to Porton just one session during the holidays, and I know it is an organisation that is partly commissioned by you and partly they get money from the voluntary sector, so they're part of, I assume, 3SG. But they only came to us once, because as a parish council we couldn't afford to give them much money. They asked us for quite a bit of money. We gave them some, and they said we won't be able to come as often as we would like to. So obviously it is a fantastic programme, as you know, because not only does it cater for children who are in receipt of free school meals, but other vulnerable people as well that local organisations are aware of and will push them to take in part. And it, thinking of food inequality, it also offers food as well. So it was such a shame that we could only have them once, because it's tackling, it's hitting a lot of targets for needy young people. So I just wondered, Have you any, so what are your plans? Are you trying to increase physical activity in areas outside of Bath, or what are your plans for the future, basically?
Can I answer that in one word and say yes? Obviously, yes, Bath is the biggest population area, so it does dominate a little bit to a certain extent, but also we have worked with a number of organisations and areas outside of Bath. We try and do that as much as possible, especially around Keynsham, Midsummer Norton, Radstock, Portland. Portland Pool has been one of the areas that we've been working with and supporting their programmes as well. And obviously the whole community asset transfer option to actually allow the pool to be run by the community was, and that's been very successful as a venture. So again, looking at different solutions for those sort of things. We're also working with places like Bishop Sutton and the football club and working out how we do lease arrangements and community asset transfers to allow the club to be more sustainable. So we're working with property colleagues and that sort of things to try and find solutions in the right spaces. It doesn't always mean building things. It doesn't mean building leisure centres. We can't do that necessarily, but we can certainly look creatively at how spaces and how the management of different sites are benefiting residents. I'll go back to Chew Valley, helping Bishop Sutton Tennis Club take on the tennis courts at Chew Valley and helping fund them to actually be able to do that. So we've done a number of those types of projects working in partnership. We haven't necessarily taken any credit, but it's been part of the work that we've been doing behind the scenes to do that. And then Midsummer Norton and the Dragonfly Leisure team, what they've been doing with that site, and then working with the town council around the development of the park spaces and the routes that have been put in for running and activity. The park runs that started in Radstock relatively recently. There's been a new park run that's been using the cycleway. So again, we've helped facilitate that. And I think Joe had a question about park run, about potentially opportunities within Bath. We are working with the park run team nationally to look at, are there any other spaces that would be suitable for a park from within Bath? Not that I want to talk about Bath too much, but there is options. We are looking at green spaces that might be available, and the park run team are quite specific about what they need, their requirements, and they'll then appoint an ambassador for different if we find the right space. So we're working with them to look at those options, and there's a group of volunteers helping to do that as well. When it comes to holiday activity and food, although we are part of the public health, there's a separate team within public health that commission that. But I will say that what they then tend to do is book different venues in different areas around, and they will. I know they've been working with Dragonfly to book venues, but it is a question that we can go back to the team and work out where the provision is and where that we can look at where Polton has been on the radar.
Delighted to hear that. Thank you very much indeed. That little bit about Polton at the end. Thank you.
Thank you. Ruth and then Chris.
Thank you. Now, I was going to say this is really reports in sort of two parts, isn't it, really, about physical activity and then leisure services. So I kind of think we've spoken quite a lot about leisure services, and it does seem overall there's a lot going on. I thought of a couple that you didn't include, actually, the foot golf, but as you said, it's not a totally inclusive list. Anyway, my point was I'm actually more interested on the other part, really, the physical activity, the informal physical activity, if you like. So I'm glad that Joanna mentioned active travel, because I was going to say that too, and I'm glad to hear that you're obviously working with the active travel team and also with the green infrastructure and nature recovery team and the public health team, because they're obviously all interlinked. But I'm very pleased also to know that part of the local plan is identifying suitable, green spaces to protect them, and I think that's very important that we try and make the most of those and also link up areas for our residents to use, and in an informal way. And I was thinking also here about, walking, so it's important to have safe, places that we can walk along, pavements and walkways and so on. And also gardening and allotments, and would be very keen to see the creation of more community gardens for growing food, for example, or community orchards, so places where people could get involved and get some physical activity without, having to be a member of a club necessarily. And also another thing, which is quite a good way of getting some physical activity, is to do litter picking. So I'll put a little plug in there, and for all the voluntary groups who do that. So I think it's also about trying to find ways of helping people to be more active without necessarily doing it in a formal way. So I'm very pleased then for schemes like Bathscape and the fact that the Chew Valley Lake has, the trail has been extended, hasn't it, the pathway? And also in the Summer Valley I see there's a project, an ongoing project to make more of green spaces. So more of that would be great, as well as looking at working in partnership with formal organisations.
Yes, thank you. As you did, we probably have missed out foot golf. The approach golf course was the approach golf was now the approach foot golf and golf course, which is introducing new activity within the Bath North East Somerset area. So, and the foot golf has done well actually. Been again multi-generational. I will say other things. We do try and do things slightly differently. For one of the things we did do, and it's based in Bath, we took out a number of squash courts and put in the bowling and trampoline park within the Bath Leisure Centre. It was quite controversial at the time, taking physical activity stuff out. But actually, now you go there, you go to the bowling area, and it's full of mums and dads and kids and granddad and granny all doing bowls together. And it's brought a whole new audience into the space. And we want to try and use those spaces differently. And that's been really successful. And then they've sort of stayed and gone, all right, I might go swimming next time, or I might go and do something else. Or there's a soft play next door, and making use of the cafe, and it's created spaces for mental health groups and older people and younger people, some of the diversionary activities. The holiday food group have used it as well. So it's having those different types of activities that can be done in individuals or groups, and having that range of activities as well, which is great. So, and I will say, food activity does integrate a lot. It has fingers in everything, so all those elements of activity. Trying to work out how we capture all that sometimes is a bit of a struggle for us. So, but it's exciting space to work in.
Thank you, Marty. Chris.
Lots of my questions have been answered by other members, but I'm very interested in the last section of your report, climate change, and I was wondering whether you would be able to seed fund expansion of solar panels on roofs, of which the council has masses, and especially if you consider the schools. And I was wondering whether there was any way of actually increasing that percentage. Thank you.
You're right, there is fantastic potential for some of our buildings, especially our leisure sites, and in fact we've just been awarded £173,000 of funding from Sport England to put solar panels on the roof at Bath Sport and Leisure Centre. That news came through late last week.
Yeah, don't tell anyone yet though.
Yeah, don't tell anybody yet.
Don't let the gala ring.
But we've also worked at Midsummer Norton Leisure Centre, have done a community use agreement with Bath and West Community Energy, and they're installing solar panels on the roof of the leisure centre at Midsummer Norton. We're also working with Keynsham Community Energy to do the same at Keynsham as well. So, and then we're also doing solar panels at Odd Down Sports Ground as part of the redevelopment. So all the sites will then, key sites will have solar panels and contribute to that sort of thing. So the answer to your question is yes, we're doing lots, I hope, to contribute to that.
Thank you. And I suppose this is going to come as a surprise to you, where my question is going to be going, particularly now that you've been talking about how you can make, say, swimming pools more energy efficient, and it seems a lost opportunity that Culverhay has missed out on this, because obviously that has always been one of the concerns about running that particular facility, that it was reliant on very old boilers, it wasn't very energy efficient, etc., etc. Maybe you might look at that again, particularly if you do a mapping exercise around areas of deprivation and access to facilities. But that would be very, very interesting, I think, across the whole area to see such a map.
Yes, we are doing some work around, we're about to commission playing pitch strategy work and also built facility strategy work, which will then feed into the local plan, and some of that will get picked up in that. Specifically Culver Hay, obviously there's a working group looking at the future of the site, and leisure is part of that, which Simon Martin is leading on, and so we're sort of feeding into those programmes as well.
Because I think, it does, and this particular point is specific to Culver Hay, but it also applies to other places. If you're looking at that distance away from your facilities, there must be a correlation to health inequalities as well. And, I'm sure that deprivation is one of those key key matters that we wish to address, but I think there would also be something around gender inequality as well, and it'd be interesting to see what types of activities are preferred by different groups who have protected characteristics as well, and whether or not we actually are placing the appropriate facilities in the right places to reduce travel, etc., and also to make sure that facilities by their location aren't also then being priced out of the reach of those that would most appreciate those.
Yes, we would certainly be looking at considering all those elements coming forward. So we would want to make sure that we have the right facilities in the right spaces. Although I will clarify that there isn't always space available for certain. We can't do everything in every space. So, but I'll give you an example where we have looked at trying to create different spaces at the Odd Down Sports Ground, where we've developed over the last few years put in some really nice facilities. We're also now redeveloping that, new facilities there as well, which sits within communities that hopefully will benefit the most, which are priority areas. So we are trying to look at those in different ways as well.
Thank you, Marty, and thank you to the whole of the public health team as well, which I think is probably just all in front of us now. Okay, so thank you. Is there any more questions or any more comments on this item? Okay, I think we would like to see more from the leisure team as a report, as finding out what you did next, and so we'll make sure that's on our agenda as well for future. Okay, so I apologise, I am running. Ruth?
Add something to that. I don't know if it's appropriate for this or not, but at some point it's to do with health and physical activity and well-being. It would be really interesting, I think, to also invite Alison Herbert of Bath Bid to come and give us a little resume of how the second Rebalance Wellbeing Festival went, which is in Bath, I'm afraid, so it is a Bath-centric report, but it has repercussions for the whole area as well, I think. So would that be possible, either as part of that or separately? I don't know. But it is to do with physical activity and well-being, I suppose, rather than leisure services. But so maybe on another occasion.
I think we could fit that into our work plan. We might also want to ask for, perhaps some report on the use of public spaces that they manage. Just picking up on Joe's point around, skateboarding is often, banned in certain big spaces, or it may not be banned, but it's certainly the design makes it less attractive. So we'll certainly pick that up. And luckily, our next item is the panel work plan. So let's make a note of that, as somehow we will find a way of including the bid within that. And just glancing at what's on our work plan already, is there anything that's missing, anything that you were expecting to see and still isn't there? Leslie?
Yes, back in July, Council passed a motion regarding knife crime. One of the things that was in that was requesting an action plan. I think that would be good to have that on there. And also, along with that, was making sure the support for the children's and young people's services in relation to that. So it'd be good to have a report on that, because there's a bit of a concern that there looks like there's going to be proposed budget cuts on those services, which is not going to help, bearing in mind what's gone on this last week in various places, not just Bristol but Bath. We've already had issues in Radstock. Thank you.
Thank you, Leslie. And it was my intention to bring back a sort of interim report from the Knife Violence Task Group, which I chair. So I'll put that on the work plan for next meeting.
We did talk about the under 5s. Bearing in mind the awful news this morning about nationally what's happening to our under 5s health-wise, particularly zooming in on the usual dental problems. But it would be good to get a report on that from our healthcare team.
Thank you. Yes, when I was referring to the plan, actually, I hadn't mentioned all the items that we spoke of during the course of this meeting that we would expect to see there too. So I think there was also a request for an update on the health for our homeless populations, the updates on child mortality, dentistry and pharmacies. Also, what else? Future provision on the 10 residents and staff consultation and the feasibility study for around Charlton House, and the impact report on equalities. This is one you mentioned, Leslie, when we were talking about the community services transport programme. You were looking. Oh, that's for a future, isn't that? That's after the transfer. I'm glad I remembered that. And then what we've just been talking about, possibly a map of inequality as well. Ruth?
The other thing I thought would be interesting at some point would be to have somebody come and give us an update on all the services for refugees who have come to this area from various different countries and how they're all settling in and what support there is and what we can do to help.
Yes, I think that's refugees and perhaps those that will be here for on a permanent basis too. Yes. Okay. So have we made a note of all of those? Right. Anything else? Any other business anybody wants to say right away? Otherwise, I'm very happy to close this meeting. So thank you everybody for your attendance. So someone